a seat.
Thanks, Marion.
Hello, everybody.
Hello.
Okay. Miss Griffin.
Present.
Mr. Kraus.
Here.
Mr. O'Connor. Miss Inamorado. Ivashevic here. Miss Hallam.
Here.
This always happens to me. You see, it's not just you, Mr. O'Connor. I always lose names, and I know Mr. Perkins. Mr. Perkins.
Here.
Mr. Nasir.
Here.
Thank you, everybody. Okay, community corrections reports, passages to recovery.
Good evening, Board.
Hi.
Gregory Price, PRICE. I'm the Director of Treatment Operations at Passage to Recovery. The current numbers as of today, we have 43 active participants, 4 of those being employed as the report date. We had 51 active participants, with 16 of those being exited from the program. We don't have any positive COVID tests or any overdose or on site. Any other questions?
Any questions?
Yes, ma'am.
Hi.
Hello.
I have a couple questions, and I'm going to ask the other folks here from the other places too, so
That's
be
fine.
ready. The first question is, do you ever have uses of force?
Not often, no. It's hardly, it's a hands-off program, but hardly ever do we have any use of force.
When it happens, do you track that? Like, is there a report like, hey, we had this many this month?
We do.
Okay, can I just ask that you've been bringing really awesome data and statistics to us, and I
appreciate
want to
it.
thank you for that. Can you add that
Of
to your report going forward? Especially if it's 0 every month, that'll look great, right?
It is. It will be. Thank you.
Awesome. And then the other track I'm wondering about is self-harm or suicide attempts. Is that something that you track as well?
We do.
Yeah, I would like to know that.
Okay.
I don't know if you know of either of those off the top of your head for this month.
We had an incident last month with self-harm, but that was it.
Okay, and then my last question is, if someone in your facility needs to receive some kind of like specialty medical care or surgeries, do they have to go through an approval process with the facility to be able to go and get that?
They do. I mean, if the doctor is actually approving it and we can get it authorized by the jail and ourselves and we can coordinate that, we will definitely get them to the treatment. But if not, we may have to send them back to the jail. Usually that does not happen because they're already out in our facility. But most times we can try to coordinate that with the provider herself.
Great, so you do, if you allow it, but you do need to get approval from the jail before it happens.
We just have to let the jail know if that's what's going on. And we'll just send a medical report to them and let them know what the instance may be, and they'll approve it from there.
Okay, so do you need their approval? If they said no, could you still do it? Could you still send the resident
Good
out?
question. I could look into that.
Okay, I would love to know that for next month.
Okay.
And thank you so much.
Of course. Anything else?
Anybody else?
Thank you.
Thank you.
All right.
Renewal Center.
Good afternoon, everyone. Darren Hood, HOOD, Director of Reentry Services at Renewal. Current program numbers are in work release 64, inpatient we have 16, giving us a total of 80. Our employment percentage was at 53% for the past period. We had, due to a large release, so turnover. Average wage rate was $14.06. Releases, we had 55 reentrants exit the program, 29 successful, 15 escapes, and 11 program revocations. Some were pulled out by court, some returned for behavioral issues. Renewal's annual Betty Esper Scholarship commenced February 1st. All application entries are due by May 31st. Last year, County Reentrant was the winner of the scholarship for schooling. I believe the gentleman was in barber school. And we have a lot of great community service opportunities for renewal reentrants coming up within the next couple of months as we move into marathon season and other big outside events hosted by the city. No fatal overdoses, no deaths. that's what I have now, so.
Questions?
Hello.
Hello.
I also want to know about the folks you brought with you, but I will start with my couple questions about use of force. Do you track those?
Yes, we do.
Okay, is that something you can give in your report every month? Just a number, how many uses of force the past month?
Yes, we can, and there hasn't been any. In fact, I can't recall any for a long time, so.
That's good news. I like that. And then what about self-harm and suicide attempts?
Yes, we do track that.
Okay, can you report that to us too? Again, just the number.
Yes, we can, and that's all through ACA accreditation. We're
have to.
We're required to do that.
And then my last question is, again, same question. If someone needs to receive specialty medical care or surgery, something along those lines, do you allow them to go and do that? And what is the process? Do you have to get approval?
Yes, as long as they have medical insurance and the provider, that's all arranged through them, prearranged. And also, we notify the jail of any type of medical things that are going on, whether it's a hospital visit, emergency room visit, from anything from a broken finger to stomach pain or something like that. So, yes, we notify the jail on each and every visit.
And if it's something like specialty medical care or surgery, like a non-emergent thing, do you have to get approval from the jail to allow them to go and receive that, or can your facility make that decision on your own?
Generally, if it's like outpatient surgery or something like that, and we've had people stay overnight, a couple days or whatever, we've never really had any problem in the past with that, as long as everything was prearranged and communicated.
Okay, and it hasn't been like something they have to allow you to do, even if it's inpatient surgery?
I haven't, as of recent, lately, we haven't had any issues with any of that.
Okay, nobody's ever told you, sorry, you cannot let this person do that?
Not to my knowledge.
Gotcha, thank you very much.
You're welcome. I'd like to introduce Scott Johansson. He's Executive Vice President with Renewal Incorporated. He will be going over some information that you requested last meeting, and there's other colleagues as well that will fulfill your request.
Thank you.
Yes, my name is Scott Johansson, Executive VP of Renewal Inc., SCOTTJOHANSON. Yeah, you're probably wondering why we have all these staff here. Well, in the last meeting, there were some questions about first responders, pathway to care and recovery, and MAT and MOUD. So I brought the subject matter experts for each one of those topics. So hopefully we can answer all your questions.
Thank you.
Yeah, I wanted to mention, I was going to speak on the first responders. I just want to put this in context in doing so. Renewal Inc. averages 397 individuals in 339 and 704. But those individuals are under the jurisdictions of the Federal Bureau of Prisons, Pennsylvania Department of Corrections, and the Allegheny County Jail. And we have a contracted physician on staff, a contracted psychiatrist, and nurses on staff. But even with that, even with those medical staff, whenever there is a medical emergency, we do have to rely on first responders to respond to that. And I want to say we have greatly reduced the number of first responders reporting to our facilities. And the way we did that is previously reported in this meeting, we've been working with the fire marshal because we were having issues with individuals at 704 2nd Avenue pulling the fire alarm so they could go out and get contraband and bring it back into the facility. Well, we've been working with the fire marshal, and we've been prosecuting or attempting to prosecute those individuals when we can prove this is happening, which has greatly reduced the number of those occurrences. So that being said, for our 339 Boulevard of the Allies facility, we had a total of 5 first responders when it comes to our county jail population. 2 were medical responses, and 3 were adverse reactions to K2. We do have an issue with K2 within the facilities, as I think just about any similar organization as ours is as well. And at 704 2nd Avenue, through our jail population, we had a total of 4. 3 were medical, and 1 was a fire alarm that was a result of a laundry machine malfunction. But as I said, we are greatly reducing the number of those. And the other thing I want to mention is We have implemented body scanners at both 339 and 704 2nd Avenue, which we believe and we're hoping, because we just turned them on, will reduce the amount of illicit drugs, deadly substances that get into our facilities, and hopefully we're going to keep all the contraband out and keep everyone, including our staff, reentrants, as safe as possible. And that's all I have. I know our time is limited, but if you have any questions, I'm available right now. Or you can come, we'll talk about tours. So go ahead.
Okay, I definitely want a tour.
Okay.
But I have a question. Also, thank you for coming. I appreciate that. Are they going to be able to report those numbers specifically about the ACJ folks' medical emergencies and stuff called every month?
Oh,
Will
yes.
they have that? Okay.
Yes, we'll have that.
Thank you very much. But my question is specifically about the prosecuting of the people who pull the fire alarm. So when they are determined to have done it, I guess, by your facility, and you decide to ask for charges to be filed against them, do they immediately go back to the jail? Like, is that something that...
No. No, what we do is we reach out to the fire marshal, and there's an investigator who will report to the facility, and they will gather evidence such as viewing camera or try to figure out why we feel that this individual is the culprit. And if there is evidence of such, then we can file charges against that individual that will go through the court system. And as a result, if they're found guilty, it would be like anyone else that does such.
But even if they're found guilty, are they then sent back to jail, or are they able to stay in the facility even post-conviction?
Well, we would have to communicate with the jail personnel, and we work with them to make the determination whether or not a person's returned.
Okay. All right, thank you.
Okay, thank you. And I'm going to turn it over to Jim Gallus, who's going to talk about MOUD
real quick.
and MAT.
I have a question.
Yes.
Again, appreciate you being here. I'm glad that both buildings are represented. Usually they're not. Is that going to continue to be a thing, or are you going to be able to represent both buildings?
Well, yes, I can. Well, I mean, we'll have staff here that'll represent both buildings.
Appreciate
Yes.
that.
I can't say that I'll be at every meeting. I usually watch virtually. That's how I know all these questions come up.
I got you. Also, do y'all have a list of policies that you can provide to the board?
We do have an operations manual, if that's what you're talking about. Or are you talking about policies regard to what?
Well, everything in general, but of course, thinking about some of the questions that Ms. Hallam asked about use of force, especially about if somebody requires some additional treatment or, additional attention. But if you have a manual, if you have something that
We
can
actually,
look
yeah,
at,
we are
you can share.
we are American Correctional Association accredited, and we have been since 1999. So we follow all the policies and procedures for community corrections and use of force and emergency medical care, and just about anything you can think of is covered under our accreditation. So we do have policy and procedures, and we can provide those as needed.
Thank you.
All right, thank you. Yes.
You said you had physicians and nurses contracted on staff. Do you mean that they're full-time? You have a full-time physician and full-time nurses?
No, the medical doctor is contracted, they're part-time. And the psychiatrist is contracted, they're part-time as well. The nurses are full-time staff.
So part-time, are they on-site weekly or bi-weekly?
Yeah, every week.
Every week?
Yeah.
Thank you.
All right, thank you.
I have one more question before you walk away.
Yes.
Just following up on the earlier one, what is the charge that the person is charged with when they pull a fire alarm?
You know what? It is. I think it's like inside. Do you remember? I can't recall, but it's not pulling the fire alarm. It's. I honestly I don't recall what the actual charge is.
Okay, yeah, if you could just come back with that, or tell somebody about it for next month.
Yeah,
All
it's
right.
like inciting a emergency situation or something. I can't.
Is it
recall.
inciting a riot?
No.
Okay, that's the only inciting thing I've ever been.
Yeah.
Anyways,
I know the answer. It's just slipping my mind right now.
okay, yeah, I'd love to know that.
It'll probably come back to me when I'm sitting in the back row.
You can yell it at me or pass me a note if you want to. Okay.
All right, I'll Google it when I'm
All
back
right.
there.
Thank
All
you
right.
so much.
Thank you. Okay, thanks.
Good afternoon, everybody. My name is Jim Gallus, G-A-L-U-S. I'm the Vice President of Program Services, responsible for the clinical programs, including our inpatient programs. And I'm pleased to report that after some careful planning and collaboration, Renewal has now begun induction of MOUD.
Awesome.
So, and I wanted to back up. I forgot that Elena DeTore wasn't able to be here tonight, so I'm kind of here feeling out for her. But and Elena and I worked on this project, and she was vital in that. So we already begun about 2 weeks ago. Our doctors have agreed to prescribe Suboxone and Sublocade. We already do prescribe Vivitrol and naloxone, and we've met with Tedisso, and we did an agreement with them, so we're ready to go with methadone as well. And since we're already doing that in collaboration with the jail, we'll just put them in the rotation. If any people come aboard that have not taken it before and decide they want to start, we'll take them over for their intake, and then they'll go the weekly Thursday trip with the rest of the people that we have on methadone. So, okay.
I have no questions. I just want to thank you for that.
You're welcome. Very welcome.
It was risking a catastrophe.
He
was whispered in my ear.
I thought you
And-
meant he was.
And
Maybe. Thank you.
lastly, saving the best for last, as per your request, this is Melissa Breckenridge. She was here maybe about 2 years ago. She runs the Pathways to Care program in recovery down at by the Renewal Center. Melissa.
Thank you. Hi, good afternoon. Melissa Breckenridge, Breckenridge. I'm the director at Pathway to Care and Recovery. Thank you for the opportunity to come here and talk about PCR services. I greatly appreciate that. Pathway to Care and Recovery is a partnership between Allegheny County and Renewal, Inc. We opened in November of 2020. We kept those doors open even through the pandemic, so we're very proud of that. We are a 24/7, 365 substance use crisis center. What that means is that when an individual is ready to seek services, they're struggling with substances and they want help, we're there. You don't have to wait until the next business day. We are open all the time. So you can walk in, give us a call. We try and make it as easy as possible to access services. You do not need a referral. Just walk to our door. Or give us a call, and if we can assist you getting to our location, we will also do that. We do have a company vehicle. We can help individuals 14 and up from Allegheny County, though we do help many people outside of Allegheny County. We would never turn somebody away from another county. We're here to help everybody and do what we can to help society as a whole. So what that looks like, our process, and when somebody comes to our door, they will come in, we'll be greeted, do an intake, gather some information. They'll meet with a assessment specialist. They'll do a level of care assessment, make a recommendation for a level of care, and then we also assist them with getting a placement, getting linked to services. We have nursing staff to do health assessments and monitoring for any emergent needs, withdrawal management services. And we have, I think, some of our best staff are our certified recovery specialists. They are our staff with lived experience. Though I must say we have 4 CRS on staff. Many of our staff have lived experience and have been touched in some way with substance use. Another great thing about our program is we don't charge anybody anything to receive services. People are shocked when they hear that. Nope, we're here to help you. We do not collect any money from you, etc. So people are pleasantly surprised about that as well. Should we link somebody to an inpatient level of care, let's say, and their bed would not be available for, let's say, next day, we would offer them one of our safe place to stay rooms. We have 14 individual rooms to keep people safe, motivated, and engaged until we link them to that treatment provider. We don't want them leaving and something bad happen to them and them not make that treatment admission. While they're in the safe place to stay, we continue to engage our staff, continue to engage the clients. They provide education and overall support. I would like to just read a quick client quote that I love it. This client said, if I had to do this on my own, I would have given up. That really touched me because we make a great impact on individuals that we serve. And I'm sorry, I'm getting a little broken up here because I know, I know what we do and how we help individuals, and especially for family members, they're not sure how to help their loved one. And that's what we're here for. That's what we say when loved ones trust us with individuals that they bring to our program. And they're just thankful that they have somebody to help them and guide them. Since we opened in November of 2020, we've assisted over 5,000 individuals in the community. And our Safe Place to Stay has helped over 1,400 people stay safe while they're waiting to get into treatment. I would like to offer, we mentioned tours. I love to show off our program and tell as many people as possible about it. So I'm happy to do that. And also, I'm just grateful for the jail that I do have the opportunity to present in the harm reduction classrooms. And so I really appreciate that. And our information being in the Discharge and Release Center. So thank you, and I'm open for questions.
Questions?
Thank you. Yep.
Yeah.
Thanks very much. That work sounds amazing. I am familiar with it from my previous work with Renewal. I had a question. You mentioned that you accept patients, clients 14 and over. Can you tell us about how you deal with or separate the juveniles from adults that are in the program?
There really is not a separation. Our goal is to get them linked to services as quickly as possible, but should they go in, utilize the Safe Place to Stay, we do have a few rooms that are kind of separate from the other rooms, just to give a little bit of separation with the older adults. But at 14, they're able to make those decisions in terms of their care. But we do try and have the Safe Place to Stay rooms separate than the other ones for a little bit of separation, but everybody's treated the same, but we do take that into account. Yep.
I just want to say first, I love Pathways. I send people there. I mean, you may have heard me say that before. I send people there all the time. I have taken people there myself.
Thank you.
Your staff is amazing. I've even called just to be like, hey, is this person allowed to come back before? And they are so helpful. So thank you. I will definitely come for an official tour because I have only seen that intake area. I just have a couple questions. First of all, are there any barriers to entry, specifically if someone is very intoxicated? How do you?
We get that a lot. We try to work with we don't decline them from coming in. We actually, it's a good place for them to be because we can monitor them. We just try and work with them, give them something to eat, try and engage them as much as we can and let them maybe rest a little bit until we can get them through the process. And in those situations, some of those individuals, they need linked to treatment as quickly as possible, especially because they're there and they're willing. So we really want to try and get them through the process so we can get them linked to services.
Great. So is there anything that would be a barrier to entry at your facility?
Only if somebody was not willing to give up a gun or a weapon, something like that. We have to keep everybody safe.
I understand. And then do you all make any connections to or referrals to housing, or is that something you plan to do in the future?
So we do assist individuals that are looking for housing, such as the Ewer House or Zakai House. We make links to.
love them.
Yeah. So we definitely assist with that. Yeah. And the Ewer House is a good, we have a good relationship with a lot of providers, but especially Your House will let us know, hey, we're going to send somebody there for an assessment to make sure they're appropriate, and then we'll assist with that referral, and we'll drive them to the Your House as well after we're done.
Awesome. And then my last question is, you mentioned a lot of the staff that were there. Are there specifically medical or mental health staff?
So we have medical, we have LPNs on staff.
Okay. And is that also 24/7?
Yes, yes.
All right, that's all I have. Thank you so much. I promise I will keep sending people there for as long as you are there to do that.
I appreciate your support. Thank you.
Thank you.
I have a couple questions.
Oh, I'm sorry.
Yeah, my
Yes.
fault. I know everybody's used to like everybody being done after Bethany talks, but we got a couple extra people up here this time. All right, so a couple questions. Thinking about like from the outreach perspective, do you provide clothing to the residents? If not, do you take donations?
We do have a limited supply of clothing, basic necessities. We have gone out to Target, Burlington. Should somebody come in and really need something, we'll purchase those items if we don't have them on hand. We also accept donations. Yes.
So yeah, I'm definitely interested in the tour. I've never been there, but I've heard a lot of good things. So I would definitely like to come see it.
Thank you.
Thank you.
And yes.
I had one question. With respect to barriers to entry, I think you already answered the question, but are there certain charges that, like if someone was charged with a certain crime
No.
or criminal history? you
No.
would- Okay.
No, we don't ask those questions. During the assessment, that's a piece of just gathering information, but that is not something that we ask at the door. No. You're welcome.
I have one more just general renewal question. I don't know if that's a you question or not. But if we are coming for like one of our surprise inspections, will we just go to the front door of either the 2nd Avenue or the Boulevard of the Allies facilities?
Yes.
Yeah, just go to the front door? Thank you very, very much.
Thank you.
We're always in.
I know, thanks.
All right, thank you.
Okay.
Thank you.
Electronic monitoring.
Good evening, Board. Steve S. Wine for the Probation Office. It's ESSWEIN. So for this reporting period, we had 606 people that were on the bracelet. During this time period, we had 99 successfully complete. We had 4 that were taken back for various technical violations. So, any questions?
I don't have any.
Any questions?
No? All right, thank you.
Thank you. Okay, public comment. I'm going to ask everyone to please respect the timer, okay? I don't like to interrupt people when you're speaking, but I notice that everybody ignores the timer because I don't interrupt you. So I'm going to have to start interrupting you if you don't honor the timer. Marion Danick.
Yeah, I can work this one. Thank you. DAMICK. I'm here for some good news. One. Welcome back. One, I'm sure everybody in the audience who was here last month appreciates tremendously how you conducted the event. I've been meeting ever since they were down, since they started. In fact, I was involved in opening the new jail. So I know this was extremely helpful and never happened before. And I hope it happens every time. So thank you. Second, this may sound not like it's pro, but it is. It's advice. You had rats last year. As I mentioned last year, we had rats. The rats have come back into my house, not as much, but the rats have come back. So I wanted to tell you to be prepared. Get your tape, your whatever out. It's the warm weather, they're coming back. And frankly, they like peanut butter. So, but you just take care. Okay. The other things were, what have we done? Okay. What I'm concerned with mostly are students, are young people. Schumann Center. I have good news on Schumann Center, which maybe some of you know. There's a new organization, they're not new, but are new for us, that is going to take over Schumann Center. They've been hired, and they're getting ready to come in May. They won't be here until May, but that's not that far away. Schumann Center, that will take care of the youth that you have in jail, which is the wrong place for them. Hopefully, they are a better organization. I did have my file. I took the wrong file than in the past. But what I want to ensure is that the board realizes Schumann Center is under your observation and you're responsible for it, which means that somebody from Schumann Center should come in every month, like you have other people, and report to you, report what is going on. And somebody or somebody's from the board every month or other month should try to visit.
Ms. Danek.
I would like to see that.
Ms. Danek.
Yes.
Your time is up.
Okay.
But I want to tell you that this board.
I finished anyway.
Okay, but this board is not in charge of Schumann. Schumann will have its own board, just so you know. Okay?
It was my impression that, in fact, it was.
Well, that's erroneous.
Who is, you were in charge?
I'm sorry?
Who else would be in charge?
It will have its own board, and that board has not yet been established. Because it's not open yet.
Okay.
Okay?
I would appreciate then that when that board is established, and keep in mind that's opening in May, I don't know, first or last, as soon as possible, that somebody notify me who they are.
Okay.
So I can talk to them.
Okay.
About the juveniles.
Sure.
Thank you. I
You're
appreciate
welcome.
that. Thank you.
Okay. Stephen Fisher.
I yield my time.
Tanisha Long.
I'm just a little taller than Marion, so. All right, hello board. Today I would like to start my comment off by reminding everyone that yesterday was the 2-year anniversary of the death of Gerald Thomas in the Allegheny County Jail. I think that's especially important when we approach the subject that I'm talking about today, which is medical neglect in the Allegheny County Jail. I can't speak for Gerald Thomas anymore because he's not here. But what I do know is that he was a victim of medical neglect in the Allegheny County Jail. And the speaker you'll hear from after me will speak about her brother's current medical neglect in the Allegheny County Jail. And since she is going to speak on his medical neglect, I will get to that a little bit later in my comment, but I do want to speak about Lewis Campbell, who currently is in administrative custody, has been in administrative custody for over 600 days, has been given no word about how he can get out of administrative custody. No one has visited him in quite some time. And we're really wondering what someone who's in administrative custody has to do to get off. There's no current and clear procedures or processes, and at this point, it's akin to torture. He has asked for medical care that has been denied. He's asked for his medical records, and those requests have been denied. So he doesn't even know what's going on with his own medical care or how best to advocate for himself, because he can barely talk to his friends and family members. Another case that you're going to hear about is the case of Benjamin Sabo, who has a leg infection, which has progressed to MRSA, sepsis, and unfortunately, the jail did not provide him medical care in a timely fashion. His leg's swollen to twice the size it originally was, and his dressings do not get changed daily to the point where he's just leaking fluid. The Abolitionist Law Center wrote a letter for the board that I would like to hand out. It is a medical advocacy letter with extreme detail about what's going on with Mr. Sabo's condition. But just a short part I will read for you, and hopefully my time doesn't expire. But for example, on December 11, 2023, Mr. Sabo's wound tested positive for MRSA and Pseudomonas, which are deadly bacterial infections and require immediate hospitalization and IV treatment. ACJ officials waited almost a month to send Mr. Sabo to the hospital. Mr. Sabo suffered in great agony from these infections as ACJ officials denied him critical IV treatment and instead gave him oral antibiotics, which were predictably ineffective. When Mr. Sabo was finally hospitalized in January 2024. He received IV treatment for only 3 days instead of the recommended standard 7 to 10 days, and his treatment was far too short to be effective, meaning he's still facing serious risk of harm. As we remember the life and death of Gerald Thomas due to medical neglect, I urge the board to take action in the cases of Mr. Lewis Campbell and in Mr. Benjamin Sabo. Thank you.
Thank you.
I'm going to hand this to you.
Perfect timing, Tanisha. It's impressive.
Melanie Duffett.
Hello. My name is Melanie Duffett, D-U-F-F-E-T-T. I am a registered nurse of 20 years, and I also was a former nurse at the Allegheny County Jail. I lasted a year, and then I walked out after I've seen the neglect. I'm sorry, I'm very upset right now. The lack of care is the reason why I quit. Unfortunately, my brother, Benjamin Sabo, S-A-B-O, is also a victim of this lack of care. When he went in, he was septic. They took him to Mercy Hospital because the arresting officer noticed how bad his leg was. I was the one to request, when I call my brother, when my brother calls me, I ask him, to describe his wound to me, the smell, everything. I know what Pseudomonas smells like. I know what MRSA looks like, and cellulitis, and he has all of these. They give him oral antibiotic after oral antibiotic, and this is going to hurt him in the long run. He's been incarcerated since October 5th. He calls, he's in pain, they give him Tylenol. He's getting all of his other meds. This is one more thing I want to say before my time is up. He is on that MOUD, M-O-U-D program, but they're giving him his Suboxone at 3 a.m., the whole whopping dose. It is TID 3 times a day. He should get it at 6 a.m., 2 p.m., and 10 p.m. As a nurse, I know this. You do not crush this pill. This pill should be dissolved under your tongue for at least 15 minutes. I think they could provide an LPN or a nurse to watch him dissolve his pill so he's getting the adequate treatment that he needs. He wants to be clean. He's looking at a lot of time. He deserves the care and treatment of a human being, not someone that's arrested. He needs 7 to 10 days in the hospital for IV antibiotics, IV fluids, for a wound vac to be put on his leg. He is oozing this horrible Pseudomonas. I talk to him every day. They checked his vital signs once. He had a fever. He is septic. He needs that care. I would like to recommend possibly a peer-to-peer with the jail doctor, if they have a full-time jail doctor, and possibly his wound care specialist at Allegheny General Hospital to do a peer-to-peer review and get him in there for the 7 to 10 days. The IV antibiotics like vancomycin, Cipro, they'll put him on a multitude, and I believe that will really help his leg heal. This is my baby brother. I raised him until he was 6 years old. We have a bond. I don't want him to die of sepsis. I don't want him losing his leg. And I know I worked in that jail. And I would never work in it again. That's all I have to say. He deserves good care. He is a good person. Doesn't matter what he did.
Thank you.
You're welcome. Does anyone have any questions for me, or what's going to be done? How will I know that he's going to get the treatment that he deserves?
Well, I'm going to ask our jail liaison to look into this and report back to us.
Okay, maybe they won't hang up on you like they do my mother and I. And there's 4 releases of information signed via his lawyer and the 2 that my brother and I signed. So they hang up on us every single time we call.
Okay.
Okay. Thank you.
Also, he is on my list to go see this coming week, so I will put eyes on him myself for you
Please do.
this coming week, okay?
Please do, because they're not doing his dressing changes as ordered per the wound specialist at Allegheny General Hospital either. So that's also making his infection way worse. He said it smells like rotting flesh. So, yeah, I don't want to lose my brother.
I'm sorry.
It's okay, thank you.
Thank you. Jim Waters?
Hi, my name is Jim, J-I-M, Waters, W-A-T-E-R-S. I was here last month and I talked about my son Alex, who's in ACJ. He was on a hunger strike. First of all, I want to thank some people in this room that actually went to see him, took like an active role in like trying to help him. Mr. Gunther, who's a volunteer for the PA Prison Society, went to see him twice. Karen Duffalo, who's the liaison for the JOB, was there a couple times, and Ms. Halam, you were there also a couple times, I believe? Okay. And the deputy warden was there offering him the HOPE program, which now he's trying to get into. Okay, so he was on a hunger strike for 17 days. He was told he was accepted into a program, but they didn't check with the judge, so she denied it. So he was only off for like 4 or 5 days. Then he went on another one for 20 days. This time he wasn't drinking water. He signed medical release, so I was allowed to call him, or to call to check on his condition. I was admonished by a guard for calling so often. I mean, I was really worried about him passing. He lost 56 pounds. He went from 183 to 127. And he made 6 trips to the hospital. The 6th trip, when he stood up to go, he blacked out and fell and broke his nose and put a gash that required stitches in his eyebrow. And he was on a feeding tube for 4 days. And I kept asking what the protocol with notifying relatives of, hospitalization. And nobody seemed to know, except I think Karen told me that the relatives are only notified in the instance of imminent death, which is pretty strange to me. Okay, I actually saw Alex on Tuesday because he had a motion to modify his detainer, which was, of course, denied. But I was shocked. I mean, he was so thin, and naturally they didn't let him shave. They had to give you a razor. I'm sorry. And his hair was uncut, but he looked pretty bad. But thank you all.
Thank you. Kina James? Kina, I'm sorry.
Hi, everybody. My name's Kina James. I'm the organizer for the Alliance for Police Accountability. So last month, I talked about the solitary confinement law. Since then, I had the opportunity to meet with Warden Dady, Deputy Warden Toma, and Deputy Warden Clark. The meeting was about a various number of things, but as the Jail Oversight Board is brand new and the administration is new, I wanted permission to provide the actual law to everybody here today. I printed out copies for everybody. I also talked about how the law was being violated, has been violated ever since it's been passed in 2021. And I know I have a short amount of time, so really quickly, Warden Harper used to always say, we don't have solitary confinement, we have segregated housing, we have RHU. I want to say that the very first line of this law is that solitary confinement, meaning the confinement of a detainee or incarcerated person in a cell or other living space. This means it's the jail in its entirety. We have gotten reports that people are being held 23-1 on mental health pods. There has been reports that part of people's out of cell time is being counted when they're being transferred to court. The law specifically says that your 4 hours out of cell time is for hygiene and exercise. That also does not include visits to a therapist or mental health specialist. Correctional officers have no say-so in whether or not an individual can be placed into solitary confinement. I'm going to say that again. Correctional officers have no say-so. We have been given a report, which I will send to the jail administration as well as the board, that individual was beaten by several COs and put into solitary confinement until he was able to heal. It also says in the law that solitary confinement is never to be used as a punishment. It also says that if the warden decides to have a facility-wide lockdown, it is the warden's responsibility to document specific reasons for the lockdown. If the lockdown is more than 24 hours, he has to show why less restrictive interventions are insufficient. I'll talk about this. I talk about this every meeting, so I'll come next month and the month after that. But do I have permission to provide everybody with the actual written law? Okay.
Thank you. Brad Korinsky.
Hello, everyone. Hello, board. I've often observed that if you want to get something done, you have to ask busy women. So here I am. It works in my house. I'm sure it'll work here. The subject I'd like to ask that work be done on is clinical mortality review. The National Commission of Correctional Health Care recommends that clinical mortality review be conducted within 30 days. Of all the awful things that have occurred over a decade at the Allegheny County Jail, our apathetic approach to death perhaps loom most large. Deaths are a sentinel event. We owe it to families, to the deceased, to the dedicated employees at the jail who often try their best in difficult circumstances to find out what happened, how we can improve, what we can learn from these catastrophic incidents. This board has the ability under Section 1725 to promulgate rules and regulation for the operation of the prison and for the administration of this board. This is a board that can get things done, not just listen, not just empathize, but to do. And so it is of critical importance that this mortality review is established, that someone is identified, hired, and prepared to conduct these when a death happens. Moving on, I did watch the working meeting over the policies, procedures, the bylaws of the board. Really great to see that happen. But again, perplexed that the board can't enact something that we see from Munhall to Mumbai, which is that if someone does not show up, they can't vote. Presence comes with vote. It has been observed that 80% of success in life is showing up, and you've heard that, and it's true. So please, vote on the bylaws, recognize the state law, recognize its attendance requirements, that the person follow the vote, and vice versa. But thank you, and I would appreciate if the clinical mortality review is looked at as soon as it can. Thank you.
Thank you. John Kenstowitz. I'm sure I mispronounced that. Oh. Okay, and you are taking 5 people's, is that?
Some of them are here. I think I've got 3 or 4. Brian is here. Yeah, if we want to do that ahead of time, I thought we could do the 3 minutes and then you talk to Brian, he'll give me the minutes, and we go down the list. Do you want to do it that way? Then I know where you're at in 3 minutes. If you want to do them all, we can go through it, I mean, of who's here. Because, yeah, I'd really like to get as much time as I can. So Brian is here. I think Linda is here. Is that correct? Okay. Courtney's not here.
Okay, hang on a minute.
Okay.
I would prefer that rather than have each person come up and do 3 minutes, that you can just do the whole thing, but let's establish how many people are yielding their time to you.
Yeah, that's what I want to do.
Okay, go ahead.
So Brian, Linda, myself, that's 9 minutes.
Okay.
And then Brett, that's 12.
Okay.
And I think that's it. Okay, so I got 12 minutes.
Brian, Linda, Brett, okay.
Okay. So my last name's Kenstowicz. I first want to talk about the life expectancy of our correctional officers. Studies have been done regarding the life expectancy of a correctional officer. One study found the life expectancy to be 58 years, in another study 59 years. A third study found the life expectancy to be 62.5 years, but this study combined the life expectancy of police officers and correctional officers. Correctional officers have a lower life expectancy than police officers. If we take a look at the deaths of our correctional officers at ACJ for the last 10 years, the average age at death is 61 years of age. Why is the life expectancy of our correctional officers so low? If we compare the life expectancy of the average American citizen, which is 77, our officers' life expectancy is 16 years below the life expectancy of the average American citizen. Again, why is the life expectancy of a correctional officer so low? Though a correctional officer's job concerns protecting residents and other staff and there are risks of violence, most correctional officers are not dying on the job from violence. Correctional officers are dying at such a young age because of stress-related issues, even suicide. Researchers have found that the suicide rate for correctional officers is 7 times the national average. One of our officers committed suicide at the age of 27. Why is the suicide rate so high? Self-esteem is related to suicide. Our job satisfaction survey found very large percentages of correctional staff who feel they are not valued or respected as a CO at the Allegheny County Jail. Forced overtime. Diving deeper into the statistics of forced overtime also provides part of the answer. I appreciate Bethany asking of Deputy Warden Beeson to provide numbers on forced overtime. Diving deeper into the numbers, one will find that many officers are working 2 and 3 shifts in a row and working over 70 hours a week over an extended period of time. The use of FMLA puts the burden of working many of these long hours on the backs of the officers who do not have FMLA. How does all this forced overtime affect an officer's life with his or her family, or should we say an absence of life with his or her family? Our officer who committed suicide was being forced to do overtime before he committed suicide. An important question comes to mind. Could this life have been saved if the officer thought he had the time and opportunity to be provided treatment before he died? The Management and Training Corporation consulting firm found the #1 factor that increased staff retention of correctional officers more than anything else was, and I quote, an understanding by supervisors about the need for personal or family time. Let's look at the statistics of the officers who are working these long shifts and many forces in a week. Let's also look at the staff turnover rates of these officers, and you will find a striking correlation. The Controller's audit report revealed that we're in need of 100 more officers. The high turnover rate and the very excessive amount of forced overtime officers are experiencing affect the jail's capacity to provide a safe environment, residents' time out of their cell, and the health care our residents are so much in need of. The NCCHC Mortality Review. In their ACJ mortality review, NCCHC identified the very critical responsibility of a correctional officer using their observation skills to assess whether a resident is still alive or not going through the blocks. After working many hours of forced overtime, is the officer going to have that tolerance and concentration to observe whether residents are still alive or not in their cells? Will the officer be able to respond to an emergency effectively if the resident has hung up and needs CPR immediately? A critical question is, what can the board do to support the correctional officers regarding this very critical issue of forced overtime? The survey I administered provides quantitative data and very graphic statements about the plight of the officers, especially regarding the forced overtime problem. Much of the data and staff statements of the survey concern the authoritarian and punitive nature of the organization under the direction of Warden Harper. Has this organizational structure changed since Warden Harper left? Change in the organizational structure. A change in the organizational structure of our jail is what was asked for in the survey and is what many outside interest groups see as a key for change. The change consists of a change from a punitive environment to a corrective environment, a change from conflict with the jail culture to an engagement and working with the jail culture, a change from an authoritarian structure of always being told what to do to a collaborative relationship in which the jail administration and frontline staff continue to work together. Is our jail moving in this direction of change? This model of change in organizational structure of our jail I'm referring to is outlined in the DOJ and the NCI workbook, Focused Leadership, a resource guide for newly appointed wardens. Now I want to talk about the correctional officer's pension plan. And let's keep in mind that the life expectancy of our officers is 61 years of age. The requirement to receive a pension is that the officer has to be 55 years of age. 6 officers never received a pension because they died before the age of 55. Several other officers collected a pension for a short period of time and then died shortly after retirement. If a correctional officer starts work at 22 at the jail and works for 25 years, and retires at the age of 47, the officer will have to wait 8 years to receive the pension. As I've said, the officer could be dead by then. Though the pension is controlled by the state board, our county executive and our controller can exert influence over this pension plan. Erie County has dropped the 55-year-old pension requirement altogether, and their recruitment and retention have significantly improved. If our county government can move in the direction of working to improve our officers' pension plan, this will be an indication to the officers that our county government is listening on this issue and is willing to support in a very direct way the plight of our officers. The critical forced overtime problem will be affected by such a move because recruiting and retention could significantly improve depending upon what action the county can take on the officer's pension plan. Conclusion. A key to improving staff retention for our correctional officers is confronting the problem of forced overtime. The board needs to learn much more about the forced overtime problem through accessing jail records and having conversations with frontline staff and administration. The board needs to meet directly with frontline correctional staff and receive a clearer picture of the problem and what ideas frontline staff have to make change. Only by us all coming together and the board talking directly to the jail culture and the jail administration about forced overtime will things change. Now I want to talk about the staff retention of our ACJ healthcare staff and the very high percentage of temporary agency staff. Since September of 2015, the ACJ healthcare permanent staff has decreased from 129 to 41. I want to repeat that, 129 to 41. That is a decrease of 88 staff, 68%. Much of the work is performed by temporary staffing agencies. In 2019, NCCHC's suicide report, this is what NCCHC had to say about our jail's significant use of temporary staffing agencies. And I quote, "We also observe staffing challenges related to multiple employers. Nurses are employed by either county or staffing agencies, which account for about 60% of nursing staff. This organization can create many challenges to building a unified team approach to a comprehensive suicide prevention program that integrates primary and behavioral care." Now, this statement was made in 2019, and the 60% figure is much higher now because of the drastic decrease in permanent staff. As NCCHC mentions, an overuse of staffing agencies can create many challenges to building a team approach. To provide a quality of care to our residents, building a team approach is critical. The team approach shares communication, expertise, and resources, and can develop a short and long-term relationship with each other. An employee of a staffing agency fills vacancies and can be moved to different parts of the jail. How much training and orientation does this employee have regarding policy and operations? Does this employee have allegiance to the interest of the staffing agency or to the care of the residents? When are those interests different? What can the JOB, the county, and the jail administration do to reverse this trend of having so many staffing agency employees? How much money is the county losing by having so many agency staff? Let's take a look at staffing retention issues related to the job satisfaction survey from last year in my conversations with healthcare staff. Threats to staff licensure. A very major reason for the high staff turnover in our healthcare staff has been the threat to healthcare staff's licensure. Licensure is the staff's livelihood. A violation on a staff person's license could have a marked effect on the staff continuing to work at our jail, their pay, their marketability in applying for another job, and their stress levels. Here is what Representative Arvind Venkat, who has been an emergency room doctor for many years, said to me. Is that 12 minutes?
Yes.
Okay. He just said start looking for another job, so.
Okay, but the board did receive a written version of your statements.
Right. So
I presume that we all read it. I read it.
Okay. Well, thank you. Yeah, I do the best I can.
Thanks, John. Thank you. Tobiah Coleman. Okay, Mike Barone.
Those are all the people.
Oh, okay. I got you, I'm sorry.
Thank you for coming.
Okay. Maria Guido.
Hi, I'm Maria Guido. First, I'd like to say that it's very refreshing to see our county executive here. It really shows, like your presence shows that you're truly invested in repairing the damage really that has been done. So I am here today to bring up an oversight board with Schumann. I will keep my time short. I do know that, Marion wanted to bring this up, but I do wanted to come to express my support in having a separate oversight for Schumann or having the same oversight board with additional members. The reason I want this, the reason I think this would be beneficial is it's going to alleviate the majority of the problems that we had in the first place at Schumann, and it's also going to stop a lot of those children from going to the Allegheny County Jail. It will stop recidivism rates. So really what I do believe that an oversight board could do is look at issues, that cause it to close down. So for instance, staffing issues. What are we doing with our staff? How are they being taken care of? Restraint and incident reports. Any type of residential out-of-home treatment for any child, no matter if it's 72 hours, 15 days, 2 years, is traumatic. So things like incident reports, restraint reports, the oversight board would be able to look at these and kind of see, are there trends going on, right? So is there restraints that are happening on this pod at this time? What does the staff need? Do they need maybe more, training on things like developmental trauma, autism spectrum disorder? And I think it will be able to critically examine the other things that are needed. For instance, mental health services. Schumann did have Cactus through Western Psychiatric in the building, but it was only there for crisis. What I'm suggesting is we do like some preventative services so we don't get to that crisis level in the first place. Another thing too that's huge is we're gonna have to support the staff. I am somebody who worked in the residential field for a couple years, long time ago, but it's a very difficult job. It is very similar to correction officers' jobs in the sense because it's physically demanding and emotionally demanding, and the staff experiences vicarious trauma, which then it impacts their ability to regulate and attune to the children, which is what they need, right? And it also causes a lot of high staff turnover, right, which causes lack in consistency with the kids. Again, continued issues. So I really think that an oversight board would be, beneficial. We're in a really rare place as a county right now when it comes to juvenile justice. We haven't had a detention center for 2 years. I think that we are at this rare place where we could really put in a trauma-responsive approach, right?
Okay, your
Sorry.
time, thank you. But honestly, we have nothing to do with the Juvenile Oversight Board, so speaking to us about this is kind of irrelevant.
I would disagree, though, because I would disagree, and it's due to the fact that the majority of juveniles do go to ACJ, and they're children.
I'm talking about when Schumann opens and the Schumann Advisory Board. We don't have anything to do with that. That's all.
I totally understand that, but this is public comment.
Yes.
And I wanted to state what I felt about.
Okay.
Okay, thank you.
Diana Hall.
You're welcome. I just want to note while Diana's getting ready is we are looking at instituting an advisory board as enabled by state law, so you should hear more about that in the next month or so.
Somebody has to take it.
Diana Hull, Hull. I'm very concerned about the practice of giving Suboxone between the hours of 12 and 4 a.m. At the ACJ. People in jail have long experienced chronic sleep interruptions, and it's easy to see how the jail environment contributes to this health issue. Intense environmental stressors, crowded living spaces, Poor lighting, inadequate bedding are just a few factors contributing to decreased sleep quality. This disturbing problem is ingrained in the culture of the jail, and I'm sure the quality of sleep is not an important issue at the jail. For such a vulnerable population, health consequences of chronic sleep deprivation are cardiovascular disease, diabetes, depression, anxiety, suicide, and it even threatens the recovery from substance abuse. Also, sleep deprivation is dangerous. The National Sleep Foundation states extremely sleep-deprived people are 70% more likely to have a workplace accident. Sleep-deprived individuals can become more confused, quick to anger, striking out for minor infractions, and I cannot imagine what this does to people or individuals with mental health issues. People who are incarcerated already exhibit elevated rates of morbidity, and it is likely that the sleep deprivation associated with jail environments only accelerates these health problems. All of this results in dangerous outcomes, both for the incarcerated and for the staff taking care of them. I spoke to several pharmacists questioning the necessity of giving Suboxone between the hours of 12 and 4 a.m. Their initial responses were surprised by the action, then followed with the statement, "This is a form of cruelty." I received information from a prison pharmacist who could not explain the reasoning for giving Suboxone in the middle of the night. Their policy is to medicate in the morning, allowing for observation. At 12 to 4 a.m., is anyone observing for adverse reactions, like respiratory depression? Also, do any of the incarcerated that receive this medication in the middle of the night need to get up early for their work at the jail? Suboxone also is highly acidic and can soften tooth enamel, accelerating dental decay. Are appropriate measures taken at the hour of 12 midnight to 4 a.m.? Institutions have a set curfew for bedtimes and getting up in the morning. Would it not be more efficacious to give Suboxone earlier in the day when there are more staff to observe side effects, follow up with dental care, reduce interference with sleep? Let's do what we can to keep incarcerated people healthy and safe, and thus reduce the work stress of those working at the jail. Thank you.
Thank you. And I would note that on our agenda today is to create a Health Services Advisory Subcommittee, which I believe and I hope that they will be looking at that practice, because many members of our board have expressed concern about the administration of those medications all at once in the middle of the night. Sharon Bonavoglia.
Judge, please don't push that button until after I say my name and spell it. It takes way too long. Give me my full 3. Thank you. My name is Sharon Bonavoglia, spelled Bonavoglia. Hit it. We at Penn want to thank Judge Ivashevic and the ACJ administration for giving us some of your valuable time. We are looking forward to meeting with Barbara Griffin, Manny, and Judge Bigley as soon as that can be arranged. It is gratifying to see the creation of a new Health Services Subcommittee on the agenda, and we strongly encourage you to include independent doctors and healthcare providers who also have jail experience on that committee. We also applaud the continued use of an exit interview committee and would like any staff leaving the ACJ to be fervently encouraged to take part in that interview process. Every death connected to the ACJ must be thoroughly investigated in order to learn everything possible to keep all residents of the jail alive. Learning from mistakes can only happen when those mistakes are brought to light, and that light must shine as soon as possible to mitigate the loss of memory that happens over time. Mortality reviews are essential and need to happen well within the 30 days that is recommended by the NCCHC. It is our hope that the JOB and jail administration will prioritize these reviews, the need to abide by the law abolishing solitary confinement, and then, along with the new Health Services Subcommittee and the JOB-led exit interviews, the lives of those County incarcerates will be safer and healthier than they are at this time. Now, if you are able, and Judge, if you would be so kind as to turn off your timer, please rise for the reading of the names of the dead.
Okay. I'm just going to say that going forward, you have 3 minutes, and it's going to have to include this reading of the names and your comments within the 3 minutes.
Starting with the next meeting, I will abide by that. I would also, because of that, strongly request that there be something that happens among the board that has this happen as part of your meeting minutes instead of having to be done by the public.
Well, we'll take that under advisement. Go ahead.
Richard Lenhart, Robert Blake, Cody Still, Daniel Pastoric, John Brady, Martin Buchek, Robert Harper, Vinkley Harris, Justin Brady, Paul Allen, Roger Millspaugh, Paul Spisak, Gerald Thomas, Jerry Lee Ross Jr., Victor Joseph Zelenek, Ronald Andrus, Anthony Tolada, William Spencer, James Washington, Damon Leroy Kays, Tim Menino, Douglas Bonomo, Zachary Som, Nicole Barufi, and Richard Shuba II.
Thank you. Daryl Palmer.
What's the guy? Oh, there he is. That's the guy who was supposed to find out about his hernia whenever he was going to ask about that. Remember? Yes. Did we tell someone to find out? I don't know. You can ask her.
Hello, I'm Darrell Palmer, Palmer. How's everyone today?
Good, how are you?
I'm okay. I'm here today for the answers to the questions that I've been asking for the last 3 months about medical procedures, religious diets, special health need diets, and why is there no explanation about me getting my surgery done. I received no emails, and everything I requested on my own says I need a court order.
I believe last month I had asked the administration to provide us with answers as to what is done to accommodate special dietary needs.
Yes, you did.
Do we have an answer?
If it's a diet based on a religious request, then that goes to our religious services department, and then they prescribe the diet based on that. If it's a diet that is required for physical needs, then that comes through us. And if it's a diet we can provide at the jail, then we do that. As for his other specific complaints, I cannot speak to it in this forum, but I could speak to it in a smaller forum if you would choose to do that.
Can you just ask me to tell him privately? Can they just tell him so he can get
Okay, this is about your hernia surgery, right?
Yes.
Okay. Did you research his case? Can you tell him privately? Okay. Is that, why don't you, can you two step outside and she'll answer your question privately? Unless you want to give her permission to answer it publicly.
She can.
Okay.
He gave consent.
He gave consent. So go ahead. You give consent, sir.
I give consent.
For her to discuss
Answer
your
it publicly.
personal, private medical conditions in public. Is that accurate?
Yes.
Okay, go ahead.
So first, we need to understand that the dates of incarceration that were included in this time frame when he was looking at having a hernia surgery. The first incarceration date was 3/7/2021 to 11/23/2022, and the second date of incarceration was 8/16/23 to 10/16 of 23. On 6/24 of 2021, general surgery consult was done about a repair. Of course, this is like a meet and greet that we would all do if we were planning on having anything done or thought maybe we needed something done. They were trying to determine if it could be performed laparoscopically or if they would need to go in to do the surgery. 9/15/2022, another general surgery consult was done. 2 appointments between these dates had been canceled due to COVID. I'm not sure if that was on the physician's office part or if this was on our part, but we had several appointments scheduled that he could not go to because of COVID.
Excuse me, ma'am.
yeah.
I only had COVID one time.
No, it wasn't you having COVID. It was related to the doctor's office canceling because of COVID restrictions or us not being able to perform the transport due to a shortage because of COVID in the building. He did have a CT scan ordered that was performed on 10/11/22, so he went out of the building for that. He was released from custody on 11/23/22. It does not look like he followed up in between that and his next incarceration on his own to have anything done about this surgery. He came back to us on 8/16/23. On 9/17/23, he went out for an ER visit complaining of abdominal pain and headache. CT was performed at this time. The physician at the ER referred to this as an elective surgery and said that according to the scan, the hernia was unchanged from previous scans. On 9/26/23, he had the appointment that we had scheduled prior to this ER visit. It was a general surgery consult. Related to the CT scan, they determined that it could be done laparoscopically. Within that month, he had been released from custody again, and I don't think that you followed up on your own for hernia surgery since then.
I have surgery on Wednesday.
Okay, that's good.
Hernia surgery.
There you go.
Yeah. This Wednesday.
Good.
And the last time I was released, I did follow up. I had surgery August 24th, which I did not make it to because I was under the jail's care.
Oh, okay.
Yeah, so I did follow up both times.
Okay.
So it took me, I've been out of jail for 2.5 months. So it took me 2.5 months to get this surgery scheduled for Wednesday.
Right.
But it took y'all 3 years.
Right.
Okay, I just wanted to make that clear.
If y'all don't mind me asking, I think last month he also asked about his diet and some of the food that he received. Correct me if I'm wrong, like one time you received nothing but potatoes, another time you just received applesauce. Is that true? Can y'all respond to that?
This thing. On September 16th, 23, after the day before his ER visit, he had been seen for a sick call request, requesting diet modifications and boost. The boost was ordered. The physician at that time was looking into the diet request modifications because he didn't see anything in the chart requiring from any of his previous physician's visits or hospital visits or surgery visits that he required a change in his diet. On 9/19/23, he was seen by another provider related to a request to be seen for dietary changes. He reported at that time that he was supposed to be on a soft diet with high fiber due to medical complications. So this provider also went back through his hospital charts where she saw no mention of a diet modification need, but she did order Fiberlax 625 to increase the fiber, and the kitchen was notified of this diet request for a non-solid high fiber diet.
And applesauce and potatoes, like, fulfill the requirements?
No, I'm unable to go back to that dietary company and see what they may have done for a diet because they are no longer our provider.
Am I wrong, or is that what you received?
Yes, that's what I received.
Can I ask a follow-up to that? Would you say that under a high-fiber, soft food diet, that applesauce and potatoes would be an adequate meal?
I would not say that's an adequate meal, but I don't know what he received specifically. I know what he's telling us. I don't know what the options were or what he received because I cannot go back to that company and ask.
Okay, thanks.
At the last jail oversight board meeting, the CO came up right after me, and he said he vouched for everything that I said that I received.
Okay. We can't have a trial here about what was served, okay? I recognize you might not be happy with these answers, but these are the answers.
It's okay.
Okay. Thank you very much. Rob Fish. Rob Fish. Mareka Lopez. Sam Schmidt.
Hi, board members. My name is Sam Schmidt. That's SCHMIDT. I'm a local activist and organizer for the poor and unhoused, many of whom and their families are affected by the injustices of carceral systems. I'm here today to address the ongoing injustices within the Allegheny County Jail. I want to shine a light on the systemic issues that continue to plague our incarcerated population, particularly regarding the lack of access to proper medical care, which we've heard a bit about already, and the disturbing trend of officer retaliation against those seeking accountability. This has already been talked about by his sister, but I want to bring to your attention the case of Benjamin Sabo, again, a man who entered the jail with a minor leg infection that was left untreated, and he's now facing amputation because of MRSA. That's negligent. His family's struggle to obtain up-to-date information about his condition is not an isolated incident, but rather a symptom of a larger problem within the Allegheny County jail system. I want to also highlight the case of James Bird, who's been subjected to inhumane conditions since early December, including being held in an observation cell with lights on 24/7 and denied access to phone calls, tablets, or communication. This treatment, which includes the denial of access to his medical documents to represent himself, appears to be retaliation for his efforts to hold accountable those responsible to their own misconduct by leaking a video of Denzel Kendrick having a seizure. These cases are not anomalies. They are indicative of a pattern of neglect and abuse within the Allegheny County jail system that is costing lives and limbs. It's unacceptable that ACJ has become the deadliest jail in the Commonwealth, and urgent action must be taken to address these issues. So I urge the Oversight Board to prioritize the health and well-being of those incarcerated in ACJ, demand accountability for those responsible for neglect and abuse, and ensure that all individuals are treated with dignity and respect, regardless of their circumstances. I know this is something that a lot of you might forget, especially if you've never been through the carceral system or in detention, but people accused of these crimes are still people, still worthy of life, good health, and the opportunity for redemption. Don't forget that these are Pittsburgh's sons, daughters, mothers, fathers, grandparents, and the vast majority of them have not been convicted of a crime. Please consider their humanity and make safety and proper health care more accessible to these community members, people we have a responsibility to protect and care for. Thank you.
Jody Lincoln, JODILINCOLN, and I'm here today to ask the Jail Oversight Board what they are planning to do about the culture of retaliation at the jail that has led to the psychological torture of many ACJ residents. Continuing what Sam Schmidt was saying, James Byrd is currently held in a psychiatric observation cell where he's been since early December. For 24 hours a day, James Byrd is in a cell with the lights that do not turn off, a camera pointed at him at all times, and no contact with his family or friends or family members. He is secluded from the rest of the population, has been repeatedly denied medical health care despite having multiple psychiatric diagnoses and on an active psychiatric hold. James Byrd has no misconduct that would justify keeping him in such conditions, and even if he had committed an act of misconduct, weaponizing his mental health condition against him is not only inappropriate, but is a violation of his human and civil rights. The Allegheny County Jail has not changed much since Warden Harper left. These are the exact tactics that we have been warning the board about for years, and people have testified about their own misconduct as well. I can not overstate the long-term trauma and harm that staff are causing this man and others. Earlier this week, there was a powerful and moving testimony at our state capitol about solitary confinement and what our state house and senate are considering to do about, our DOC and jail systems. I encourage you all to give it a listen, take inspiration from our reps and senators who are taking this issue seriously and actively. This board is the only body that is capable of intervening in situations like Mr. Byrd's, so I implore you to get into this jail and visit this man. For some of you, it might be your first time doing your jail oversight board visit, but for his sake and the sake of the 1,700 other people in that jail, please make your visits count. I'm glad to see that the members of this board are beginning to move in a direction that signals that they are willing to take action on issues that affect our incarcerated neighbors, but this requires immediate action. Who on this board is going to commit to visiting this man and investigating this issue? Thank you. But also, thanks for the... Also, getting the liaison on it too would be appreciated if you're not going to visit personally. Yep.
I make a motion at this time that we direct the jail administration to give us, the Jail Oversight Board, a complete report on Mr. Sabo and Mr. Mr. Byrd.
I'll second that motion.
Mr. Campbell?
Oh, that's one of the broken ribs.
The broken wrist.
No ribs. Lewis Campbell.
Lewis Campbell also.
Yeah.
Okay,
I'll
the
second that.
motion is seconded. All in favor?
Aye.
Any opposed? Okay, so we'd like a report, and I understand, the board should understand that this is going to be medical records of these individuals, so when you receive these, you should not share them or disseminate them to anybody. Cool. Okay, thank you. Cynthia White.
Good evening, everyone. My name is Cynthia White, W-H-I-T-E, and I'm here regarding my son, Luther Springs Jr., who has been incarcerated since April 5th of last year. I have people's names, the COs and sergeants. They beat my son. They tased him 4 to 5 times, which could have killed my son. They put him in solitary confinement for 17 days so no one could visit him to witness his injuries. He was punched in the face. He was kicked in the ribs. He was denied medical attention. He was targeted by these correctional officers, Sergeant Washington, Sunday, Solver, and Holt. Those were the 3 that abused my son. Due to him not getting medical attention when he was targeted and labeled as a snitch for calling me, and me constantly calling Amelia, the warden's secretary, and speaking with her, he was jumped. He was beaten again, broken jaw. He was taken to the hospital. They found his ribs were bruised. They were fractured because he didn't receive any medical attention, which led to him having a blood clot in his lungs, which he is not getting medical attention for as of now. I have medical records. He was supposed to see a pulmonologist. They have not scheduled that appointment yet. They put my son on blood thinner to try to dissolve instead of sending him to a pulmonologist to be evaluated for his condition. Everyone who has lost their family member, you have my deepest condolences. I don't want my son to die in Allegheny County Jail, and I'm sorry. I can't get no help. I've called Internal Affairs inside the jail since the end of last year, November. I have not received a call back as of yet. I called yesterday, and I have not received a call back as of yet.
Ms. White, are you willing to give us your son's name?
Luther Springs Jr.
Luther Springs?
Springs.
Okay. I move that we also direct administration to provide us with the records of Luther Springs Jr.
Second.
All in favor?
Aye.
Okay. Thank you very much.
Thank you.
Patrick Tierney.
See this? These are the pictures of them.
Patrick Tierney, Tierney. Nice to see a new jail oversight board. Nice to see you, Bethany. I'm a journalist. I'm with an associate with the University of Pittsburgh's Latin American Studies Center. I'm a friend of John Kentowitz, who's been helping me with immigrants who are jailed in the county. Not in the county, in the state system, and also children who are released from ICE on their 18th birthday. John's been a huge help, and I'm basically supporting him here, and I've been doing that for over a year with very similar requests that have essentially, until now, gone unheeded. But so I'm just going to reiterate, I don't want to annoy you, don't want to be redundant, but every couple months we ask for the exit interviews, and we keep asking for it, and we've had editorials about it, and we know you've created a committee now to look at this problem. And as a journalist who's worked in war zones, I know that in some ways the inability to get exit interviews done does not depend just on the intransigence and the intractable opposition of the administration at the jail. It's also the shame, the guilt, the fear of the people who are leaving because they feel ashamed and they feel that they have been complicit in what amount to crimes and abuse. And so they need, like anybody who's interviewed in a war zone, they need guarantees of anonymity, they need guarantees of they will have amnesty, and they need assurance and encouragement that they will be listened to without judgment and without malice. So we know you're doing excellent new things, very encouraged by the motions we've heard today. And all I would say, and I don't mean it as a criticism, is that the committee will not get far without your specific and dynamic involvement, because the opposition is intractable, and it's not just on the administration, it's also the fear of the people who are leaving. More than 100 people have left since this board voted to conduct exit interviews, and only 5 interviews have been done. So you're batting less than 5%, and it won't really improve quickly unless when you go to visit the jail physically, when you speak about it publicly, when you're on television, that you make it a point to stress this, because I know as a journalist and also working with ICE and the state correctional system that the exit interviews are not peripheral, they're not a minor thing. It's only in getting that light from the people who've been part of this system, which is so traumatic for everybody involved, including, I imagine, for members of this board, that we'll get understanding what's really going on and be able to deal with it. So thank you again. Thanks for your great start.
Thank you. Thank you. Okay. Do I have a motion to approve the minutes of Thursday, February 1, 2024?
Excuse me, Judge, I'm sorry. I hate to interrupt, but we have 2 online public comments that I think should be read.
Okay, we don't read the public comments that are sent by email. That's not been the board's practice.
Historically, it was.
I don't think it was. I feel that if somebody can't come here to speak, that we shouldn't read their public comments. Okay.
Yeah, can I just, yeah, that's what I was. Yeah, so what I was going to say is that was actually made a policy under both Judge Housey and Judge Clark, and it now says when you go online to submit the public comments that they will be read in their entirety into the record in the public meeting. So we do kind of.
Well, if it does say that online.
Does it say during the public comment period?
Yeah, I can read it from the, are you on the website right now, Manny? I can read it from the website and tell you what it says.
I think that's something that we should consider in our bylaws, because I don't think that we should read them, just because this takes up, it's 10 to 6. We have not discussed any business.
It says, wait, I just had it. It says something about comments will be read. Hold on. Written comments and questions will be read in their entirety, provided they do not take longer than 5 minutes to read, on the submission court's website.
I believe you, and we will read them.
Thank you.
Okay, I'm suggesting that we reconsider this practice in our bylaws. Do you want to read them?
I think Manny should read them.
You get more time if you submit online than you do if you come in person?
No, a total, I think, of 5 minutes.
No, you just said 5 minutes.
Yeah, but there is a character limit on the online submission, so you only get 750 characters total. So it could never be a 5-minute it couldn't even be 3.
But it does say 5.
It says as long as they do not exceed 5 minutes, yes, but you literally could not put enough characters in it to even hit the 3-minute.
But does it make any sense to you that it says 5?
Maybe in case the person who's reading them talks really slow. That's the only thing I can think of, truly. Yeah.
I do talk slow, but this won't even take 3 minutes.
Yeah, this is like 30 seconds each. Yeah.
I'm just saying, does it make any sense to you that our website says?
Yeah. Yeah.
I know.
Right.
Please don't speak out in the word. It makes no sense that our website says that.
Okay, go ahead, Manny.
Yeah. I know, it makes no sense.
Go ahead. No, we're not taking questions. Go ahead, Manny.
All right, so the first public commenter is named Malcolm Williams. It says, every single person sitting on the ACJ Oversight Board is responsible for every single death that has happened under your watch. It is horrific and shameful that human lives are being thrown away, and none of you have faced any criminal charges for your negligence. That's the first one. The second one is from Laura M. Valkovic. A family member has been incarcerated at ACJ for the past 3 weeks. During this time, the following occurred. 1, he did not receive his medication for 3 days, and when he did, not the correct dosage. 2, he ordered $50 worth of commissary, which he did not receive. Calling the jail for a refund, calls went unanswered. Voicemail boxes were full, and options to press 5 for caseworkers were not valid. After finally getting in touch with the commissary, he was told a refund would be applied to the trust fund. That has not occurred. 3, while eating lunch on the pod, another inmate found rodent droppings on his lunch tray. 4, the pod was on lockdown all day on March 4th and March 5th. Basic administration is woefully lacking. When will this improve? That's it.
Thank you. Thank you. Can I have a motion to approve the minutes of Thursday, February 1 of 2024?
Second.
All in favor?
Aye.
Any opposed? Okay, motion carries. Thank you. We're going to go out of order because a board member or two has to leave early. So we're going to go to new business. New business, there's a motion, the controller and county executive to directing the ACJ and HSA to adopt best practices regarding screening for autism spectrum disorder and implement appropriate assessments during intake and processing.
Thank you, Judge. I did want to do just a verbal amendment at the end, and that is to say as soon as practical. There's going to be a little bit more stress in intake. I don't know if the warden's going to comment on this, but I'll make a quick comment on this, is that the warrant office at the city has now, is that correct, they have shut down over weekends? Is that official now?
Yes, I believe that was on the news.
So we want this done as soon as possible, but there are going to be more people that possibly could be overnight and into holidays because the city has decided to shut down that office. So that's going to create a bigger problem. But on this, I want to thank the executive's office, my office. I know Ms. Hallam, this has been talked about for a number of years, and Lou Randall, who couldn't be here. I know I don't want to go into what happened, but she couldn't be here tonight. But this is something that's great to start this screening process. You know, something as simple as 10 questions. I want to thank the jail for accommodating this as well. And like I said, the executive for working with the jail to get this moving forward. So that's all of my comments at this point. I will pass it off to the executive.
No, thank you.
Sorry, Executive Inarano, before you start, before we have discussion about it, we need a motion in a second to start discussion.
Sorry, so moved.
I'll second.
Yeah, good.
Okay, so on the motion, thank you, Controller O'Connor, for those comments. And thanks to Lou Randall, who again isn't here, but really brought this to our attention. And as a new board member, I appreciate her voice, and I think it speaks to the power of public comment. We are taking the remarks that are shared here in this meeting, and we are working on putting them into practice. And I know for a lot of folks, it seems like it's long overdue, but these things take time. Because we want to make sure that we do them right and embed them into best practices and ensure that they're adopted across the system. And I'm just looking forward to seeing the administration's plan on how to implement this, because we have to find ways that we can support people with autism, even if they are caught up in the criminal legal system. And I understand that there are a lot of things that need to be worked out. There's a lot of intersecting issues and challenges in doing this, but it's what's right, it's what's best practice, and those are the things that we want to adopt in this facility. So thank you.
Any discussion? So are we amending the motion? I'm sorry.
Just a verbal amendment at the end to say as soon as practicable.
Okay.
Can I read mine? 'Cause I want to make it.
So we're amending it to say as soon as practical, because I presume that the jail administration has to figure out how to implement this.
Yes, and that's why I raised, the question, because I don't know if I'll be here for the warrant, but the warrant office closing is going to put a lot more stress down there as well, so.
Okay. All right, all in favor?
Aye.
Aye.
Any opposed? Motion carries.
Okay, I'm also going to do a verbal amendment to this one, like Controller O'Connor. But this is a motion to change the uniform color for the general population of people incarcerated at the Allegheny County Jail from red to green as soon as practical. All other existing uniform color schemes to remain the same. I'd like to make a motion to approve and ask for a second.
Second.
Questions?
So I think that this is one of the best practices that we can adopt at the jail. It's something that's been long overdue, changing the general population's uniforms from red to something else that's in line with best practice and color theory. We know from I think the report, the color theory report that you referred to, Councilman, or Councilwoman Hallam, is the DOJ NCRS study, correct? The color and its effects on inmate behavior. You know, when we came to this motion the last time, it was not in the full, we didn't have the full context of what are all of the other colors that are available, and it felt like we arbitrarily chose yellow, which, you know, even if we're looking at best practices, is a less desirable color than something in the family of, you know, blue or green or violet, according to that report. And, you know, I know that in my conversations with the jail administration that we are, you know, they have the capacity to deliver on these changes and report back to the Jail Oversight Board within 30 days. And I feel like we are constraining the jail's ability to be able to make the best decision based on what's available on co-stars, you know, looking at the full scope of policies. So I would motion to table this particular motion, but also with saying that the jail administration, asking them to come back to the next Jail Oversight Board meeting and deliver your plan on how you are going to change the general population's uniforms from red to one of those colors, either blue, green, or violet, as outlined as best practice.
I just want to point out, I did change it to green in my verbal amendment, so it's green now.
I think that the county executive is requesting to table. No. Well, that's what she's requesting. Her motion is to table this motion to give the jail administration an opportunity to come back to the Jail Oversight Board with a recommendation as to the specific color. Is that correct?
That is correct.
Okay.
I believe that we are being, with this motion, being too prescriptive without having the full scope of what is available, costs, what colors are available, everything in that nature. So, you know, having, you know, getting the end result, right? The end result is to change the uniforms from red to one of those 3 more calming colors that positively impact behavior. And so this still gets us to that point without being overly prescriptive and dictating granular level of policy.
I would just like to remind the county executive, we do have a motion in a second, so we do need to take a vote before we consider any additional motions. I will not be voting to table, first of all, because you need a 2/3 vote to pull something once you table, but also because we have been talking about this for so long. The money has been allocated. The color was changed to meet the color specifications that were suggested. As soon as practical, that amendment also gives the jail the time to make sure that they are able to do it with fidelity to the best of their ability. We talked about this in the working session. We've been talking about this for months now. I believe that this is just a stall tactic. And again, we're voting to say change the color to green. The jail, as soon as practical, can make it happen along with your office. So I will be voting no to table if that comes up, but I believe that we need to take the vote on the motion first, as amended.
Would you consider removing the color green and saying to remove the red and change it to one of those 3 colors that are best practice?
Tell me the colors again. Green.
They are.
No, I would do that. I would change it to change the color
To a color recommended by jail administration.
Well, no.
So, it's the best practice in the report, so I do see the importance of that.
Yeah.
So they're within it's green, violet, or blue.
How about green or blue? Can we compromise on that? I just don't want us putting fluffy purple uniforms on everyone. That's my only thing. But I would be willing to amend it.
That's also what the data tells us. So
yeah,
the other one that we.
So can we give them one of the 2? And it can be any shade of green, any shade of blue. Can we compromise on that, please?
Can we include all the colors that are shown to have the most positive
Absolutely.
outcome.
I would like to amend the motion to change the uniform color for the general population of people incarcerated at the ACJ from red to green or blue or violet. All other existing uniform color schemes to remain. Do this as soon as practical. Cool?
Yes.
Okay, I will motion to do that. I would ask for a second.
I second.
Thank you.
All those in favor? Aye. Any opposed? Motion carries.
Thank you, guys.
Okay, we have a new subcommittee motion. Mr. O'Connor or Ms. Inamorado, would you like to?
So I'm bringing this motion before the board. Obviously, the folks who attend these meetings, you understand the need for us to look deeply into our medical practices at the jail. And that's why I'm bringing this motion before the board today, and want to thank Controller O'Connor for co-sponsoring this motion. This would create simply a Health Services Advisory Subcommittee for the Jail Oversight Board. We are really looking for qualified medical professionals to serve in this capacity and advise the Jail Oversight Board on best practices and avenues for adopting different policies that can lead to a better system of health care and ensuring the health, safety, and welfare of the people who are currently residing in the ACJ. We have a tremendous amount of resumes that have been submitted on the website AlleghenyForAll.com for people to serve on this board, and it was a really tough decision to make the 3 appointments that we made from the community. So we do have a list of folks who have expressed interest who meet that criteria of having qualified healthcare or medical experience. But if you are listening to this, if you're in the audience and you would be interested in serving on that subcommittee, we ask that you visit that website, AlleghenyForAll.com, submit your resume, and let us know that you're interested in serving in that capacity. And I look forward to bringing those names in front of the board so we can decide who will be on that subcommittee and, get going on a lot of the issues that we've talked about today.
And I would just follow up to thank the executive, her team, her staff, listening to people, getting this input is something that she said, and I think it's great that we're doing this. I also want to say that earlier this week, was it Monday or Tuesday? We met with healthcare staff Monday, so I want to thank them for joining. I know John was part of that, as well as our staffs were. So I just think hearing from everybody is very important when we have this difficult conversation. And then I also want to thank Rob. I know you sent an email about this as well, being interested. So thank you. I think, after we did our audit, we saw the need for this conversation. So I think it's really important that we're doing this, and I just want to thank the executive for pushing this forward.
I second the motion. All in favor?
Aye.
Aye.
Aye. Any opposed? Motion carries. Okay, next is appointments to existing subcommittees. I would note for the record that the board did receive an email from Mr. Perkins suggesting that perhaps we not rush and fill all these subcommittees at one time. I don't know, what's everybody's thoughts?
I agree with Rob that we are talking about subcommittees in the bylaws, that we are like this close, for everyone's information, we are this close to having bylaws. I think we should finalize those and then move forward with the committees. We've been doing the work of the subcommittees in the main working group, so I don't want to rush and, do it without actual process in place. So that would be my opinion.
Okay,
Just to hold
I
this.
agree.
Yeah.
All right, everybody agrees. Okay.
Don't say table, hold.
Hold.
Table's harder to get out.
Okay. Warden's report.
Before you start, Warden Dady, thank you so much for sending it ahead of time. But if we could get it sooner than when we get here, I'd just like to prepare a little bit more. But thank you for having it here when we got here so I could read over it before you give it. Thank you.
Sure. Again, we typically are working on sometimes what we're going to say up until this meeting. So, just getting it to you when we did prior to.
It's improvement.
All right?
Yes, I'm happy with that. Thank you.
And if we could in turn ask for anything that you have that you could send to us that you're going to speak to us about. We would definitely, that would be helpful.
I'll think about it. Sometimes I also figure my things out while I'm
Motion?
sitting up here listening to public comments. But yeah, we can work on that.
All right. Some of what I have for my report has already been said through medical here, but so there may be some redundancy, but I want to make sure that it gets said. So good evening, board. We respond to a number of requests in writing prior to this meeting. Some of those answers cannot be addressed in a public meeting. We are happy to provide the board with information in the appropriate setting. We were asked about how the jail accommodates individual dietary restrictions. And those diets can either be, as was said, for medical or religious reasons. In the case of medical restrictions, the diet must be ordered by the healthcare provider. This is noted in the patient's electronic health record, which you have heard, and sent to Trinity, the jail's meal service provider. In the case of religious diets, the individual can contact the chaplain's office and fill out a request form to receive that particular diet. This has been occurring leading up to the beginning of Ramadan, which begins Sunday. Reverend Dr. Carissa Howe, the Director of Chaplaincy for the Foundation of Hope that provides services at the jail, addresses this in the February 2023 meeting on pages 74 through 76. The jail has worked continuously with the Jail Oversight Board liaison to follow up on questions and requests raised at these meetings. The JOB liaison visits the jail frequently to address concerns and conduct investigations. The liaison is able to speak to the incarcerated individuals, and documentation associated with complaints are made available at the facility. Segregation logs and use of force packets are also available to be viewed at the jail. The liaison can also view grievances and follow up as part of the investigation. It was asked that we attempt to come up with a way that grievances can be sent to the board. This is an ongoing ask that we are looking into how to accommodate. As we have stated, we are happy to arrange for any board member to view unredacted records in the facility. As we stated, we constantly work on our individual reports, like I had just mentioned, right up to the time to this meeting. So at times it's not practical for us to email the report prior to the meeting, which is what we provided today. The NCCHC returned to the facility on February 13th and 14th to conduct a comprehensive mortality review and to follow up on last year's report examining the jail's intake and detox protocols. NCCHC staff were complimentary of the jail's efforts at improvements that we have made, including the increased hydration offered at intake and on the detox units. They also noted that staff members interviewed expressed a genuine commitment for providing the best medical care possible to the incarcerated. We are currently awaiting the report from their visit, and the NCCHC is open to providing feedback to the Jail Oversight Board in an executive session as they have in the past. And that concludes my report.
Good evening, Board. Update on staffing. This week, we onboarded Captain Matthew West from the Lawrence County Jail in Newcastle. The jail's training department graduated 16 cadets to full-time corrections officers on Friday, February 16th. Our next class begins on Monday, March 25th. Currently has 24 candidates enrolled. Physical agility testing for the June class began last week with 11 passing, and our next test will be Wednesday, March 20th. The jail also recently attended job fairs at West Mifflin High School and the University of Pittsburgh. Currently awaiting transfer to the PA Department of Corrections. We have 19 males and 3 females with 300 Bs, 7 males, 0 females with detainers, and 7 males, 0 females with open cases. The longest wait time on a 300B was received on February 23rd, and the shortest wait time is from March 6th. Federal inmates in the Allegheny County Jail is 20, 12 of which are United States Marshal holds, and 8 are federal transfers for Allegheny County Court. Use of force numbers from February of 24 is 29. Number 5 on my report is for the board's information regarding the hunger strikes from February, okay? Due to HIPAA privacy concerns, I can't read it into the record in a public forum because it can be linked to an individual or individuals, okay? And finally, I would like to announce that Corrections Officer James Larkin and LPN Inez Bergman have been named ACJ Correctional Professionals for the month of February. The jail administration congratulates both of them. Deputy Warden Clark will continue with the report.
Good evening, Board. Chaplaincy and pre-release. On February 20th, the chaplain's office started a new grief support group. Therapy dogs, Pecos and Charles, participate in the group and aid participants with the emotional challenges associated with grief. The therapy dogs' interactions with participants have been very beneficial to the group. Discharge and release. The Discharge and Release Center assessed 333 individuals and distributed 72 boxes of Narcan, 105 fentanyl and xylazine test strips, 860 condoms, and 373 bus tickets in the month of February. The DRC continues to make referrals and connect individuals to services in the community. Contact visitation. The jail is continuing to host contact visits for juveniles, incarcerated workers, veterans, and program participants on designated Saturdays throughout the month. For the month of February, a total of 96 incarcerated individuals received contact visits from a total of 175 family members. Residential placement services. Based on orders from the court, Residential Placement Services facilitated the transfer of 58 individuals to alternative housing in February and 24 individuals to substance use treatment through the diversion program. The program received 26 new referrals and served a total of 70 participants in February. The Medical Assistance Program assisted a total of 124 individuals with completing medical assistance applications upon release from the jail in the month of February. Reentry services. On February 20th, Three Rivers Youth presented their services to the female program participants. Three Rivers Youth provides services to all age groups and offers behavioral health treatment, case management, and employment services, as well as reentry services to aid individuals in their transition back into the community post-release. On February 22nd, the Beck Institute toured the jail's reentry center, educational programs, and discharge and release center. DHS formed a partnership with Beck Institute as a technical assistance and training provider to embed principles of recovery-oriented cognitive therapy, a cognitive behavioral intervention, into the programs offered in the jail. Incorporating CTR throughout reentry programming will provide a cumulative dose of cognitive behavioral interventions, taking a strengths-based approach to collaborate with participants to achieve adaptive models of living, develop aspiration, and engage in personally meaningful activities and strengthen their beliefs about being capable of achieving their desired future beyond justice system involvement. The jail's reentry program and Discharge and Release Center has partnered with the program's Colorful Backgrounds Expo and Fishers of Men to provide workforce development, employment, and training opportunities that will support individuals in their transition back into the community. Educational services. In preparation for the upcoming primary election, the caseworkers have been distributing voter registration and absentee ballot forms to the housing units. Everyone is being encouraged to complete the forms and submit them to their caseworker. On February 28th, the jail hosted a presentation for incarcerated veterans. The subject matter of the event was employment. Pittsburgh Hires Veterans, Partners for Work, and the Allegheny County Department of Veterans attended and met with incarcerated veterans to provide them with an overview of their services, which includes assistance with resume writing, interviewing techniques, and job placement. Participants were provided with information on how to access these supportive services and resources. Pittsburgh Hires Veterans and PA Career Link are going to assign a representative to the jail who will establish a one-on-one relationship with incarcerated veterans prior to release. Allegheny County Veterans Services currently has a representative who comes into the jail weekly to meet with incarcerated veterans. That concludes this month's report for programs. Amy Shaw will provide the healthcare services update.
Thank you. Our continuation of medication-assisted treatment includes the following during the month of February. There were 25 individuals prescribed oral naltrexone, with 3 individuals receiving Vivitrol injection prior to community release. 254 individuals were treated with Suboxone, and 34 individuals were treated with Sublocade. Of these, 23 patients were transitioned from Suboxone to Sublocade to support their recovery. Methadone continuation services have treated 39 individuals. During the month of February, 10 patients were admitted and transferred to Torrance State Hospital. 6 patients were committed to Torrance State Hospital. 3 patients had their commitment to Torrance for competency restoration rescinded due to clinical stabilization. Currently, 25 patients are awaiting admission to Torrance State Hospital, with the longest waiting since October of 2023. In the month of February, 1 individual was identified as a Tier 5. 26 unique individuals were identified as Tier 4. Sick call requests for medical, 61, longest waiting 3 days. Sick call requests for mental health, 6, with the longest waiting 2 days. Psychiatry, 319, with the longest waiting 13 days. And mental health specialists, 12, longest waiting 1 day. In updates in healthcare, we have now onboarded a medical director for mental health. Her name is Amy Silberschmidt, and she started with us in January. We have also hired a new medical director for physical health. Her name is Dr. Mary Demko, and she will be joining us in May. We acknowledge that we did have a backlog of sick and chronic care calls while working on getting new providers in and trained. We are now in a better staffing situation, and in an effort to address these needs, we have started to again hold level clinics, which allow us to see the patient on the floor that they are housed on, in addition to seeing patients in our regular clinic. By adding these additional level clinics, 180 appointments were completed this week. It's also important to remember that the jail offers both emergent and routine health care. Emergent health care is always available, and jail health care staff respond to emergencies within the 4 minutes allotted by the ACA standards. Individuals can then be transported to the jail's medical housing unit or sent to the hospital if deemed necessary. The sick call queue functions more like making an appointment with your doctor, which can take weeks, maybe even months outside the facility. That is all I have. Thank you.
Okay, I have a few. I missed it though. Did we get the number of forced overtime shifts?
Ms. Hallam, we sent a request for clarification shortly after the February meeting because we were unsure as to
Did you send it to me?
It was sent to the entire board, I believe. Yeah.
Well, can you tell me what that message said? I didn't see it. Did anybody get an email about clarification? Can you tell me what it said?
It was just the ask was unclear as to what was needed. Okay.
Oh, so in a lot of the exit interviews that we've done and conversations that I've had with staff at the jail, over and over and over again, I hear that the reason that staff leaves or is unhappy and considering leaving is because they're forced to work overtime shifts and they can't have a life outside of work at the jail. So I had asked, actually exactly what the agenda says is how many overtime shifts are forced and how many of them are you filled? Like how many do you try to force and how many do you successfully force?
Okay. So if I could, Controller O'Connor, his staff did a comprehensive audit of overtime. I mean, all of that information, and it's available in the report that was published, and it gives a bigger picture of the overtime, the forced overtime, the reasoning behind it, how many people refuse, that kind of thing. But it's starts on page 18 of his audit.
I'm aware.
Okay.
That was a historical report. I want you to report this to us every month going forward.
Sure. Can I ask to what end? I mean, where is this information?
Till the end of the existence of the Allegheny County Jail.
What I'm asking, Ms. Hallam, is the county and the jail are currently engaged in interest arbitration with the Corrections Officers Union to get our new collective bargaining agreement established. So I just want to make sure where the information is going, what's being used.
Oh, this is completely unrelated to that. This is, as you know, we have nothing to do with contract negotiations on this board. I mean, I don't even on council have anything to do with that. I'm really just trying to understand as we're proceeding with these exit interviews, and that is the issue that comes up over and over and over again. I want to see if it's changing at all. Are we filling staffing holes and no longer requiring that? Are people going to be happier? That's what I'm trying to track, is it getting better over time?
So you're asking for the number of forced overtime by shift per day?
Oh, Oh, sure, that's great. I was really just asking for the month, but if you're offering to do it per day, that would be great.
I mean, that's why we asked for clarification, because we're unclear as to what to provide.
Sure, by day would be fantastic. But really, if you can just tell me every month how many shifts are forced, how many people, and how many of those actually are filled. Because I have to imagine that sometimes you attempt to force somebody to fill a shift and they say no. Is that true? Right. So I want to know the total number that you're requesting people to do and the total number that actually happen.
So that documentation exists, but not in a format where the data can be easily readily available. So, and it's burdensome. So we just want to make you aware that would be drawing our resources from other things like exit interviews, like our payroll for those staff members.
Sure, I appreciate that. I think this would be very helpful to us.
But those records are also always available for you to view, or the liaison, or anyone else to view at the facility, for them not to be correlated in a manner that it can be put out.
I think you guys do a really great job at aggregating all of the data that you provide us for this meeting, and I'm trying to constantly make sure that we have all of the data that we need to be able to do our job. So it doesn't need to be per day. If that is too burdensome, I was really just looking for it per month. How many overtime shifts are being forced on the staff at the jail?
So to be clear, if we have 100 forces, you want to know that answer, like 100 people got called.
100 shifts got called. If sometimes the same person gets forced 10 times in a month, maybe. I want to know how many shifts are forced every month.
Right. But so for the month, there are 100 forces of that. You want a solid number, so you gave us.
Yeah, 100. We attempt to force 100 shifts. We were successfully able to force 80 shifts. I would like those two numbers. Thank you very much. Okay. Let's see where to start. Okay, so my first question is about damaged clothing. So that would be the reds, any underwear, undershirts, socks. How often do incarcerated folks have the opportunity to exchange damaged clothing? Once a month, once a week, daily they can request it?
They can request it to their level staff, their unit managers. If something becomes soiled, if it's not usable anymore, we can replace them real time.
And does that happen? Is there any time that those requests are rejected?
Not that I'm aware of, no.
Okay.
I mean, yeah, I mean, if we have information that the person intentionally damaged things, we'll replace them, but then that individual will be charged the monetary replacement value for those clothing or mattress or whatever it may be.
Okay, what is the monetary value that they are charged to replace a red uniform?
I don't have the cost sheet in front of me.
Okay, that's cool for next month. We can do that for next month. But at any time, someone can report and say, my reds got ripped, my underwear has holes in it, my socks have holes in it, and they can get new ones?
Yeah, we have plenty in surplus.
Okay. My next question, and I felt like we talked about this before, but I just know a public commenter brought this up tonight, so I wanted to clarify on it, about family notification for hospitalizations. The public commenter alluded to only if death is imminent is the family notified that their loved one was sent to the hospital. Can you expound on what that specific policy is?
We don't notify the family when someone goes to the hospital, because obviously that poses a risk to our officers and the person that's in the hospital. So that would not be best practice. But we do, if the person gets released from our custody while they are in the facility, then the hospital would notify them. Or if they are not doing well, maybe not imminent death, but that they are not doing well and it's very acute, then at that point we would talk about it and probably notify the family.
Okay, wouldn't we want the family to know, like before the person is on their deathbed, that their loved one was sent to the hospital?
That would be great, and generally, long before the person's on their deathbed, we request release so that the family can be with them.
Okay. And then speaking of those releases, I know we had requested that we be notified when the 6A releases happen because somebody's sent to the hospital or you're worried that they are not going to make it. But I know for a fact that there was one that happened last week and we were not notified about it. Can you please speak to that?
A 6A or a release in general?
When the jail releases someone from custody because they're sent to the hospital and they believe that potentially death is imminent.
No, That's a fine line, because that is part of what I do for my job. I do the critical inmate review, and I quite frequently request that people are released from jail, because I feel like probably it is not the best case for them to remain in jail in order to get the services that they need. So quite often, these people that end up going to the hospital, I have already requested for them to be released. So I will notify at that point bail, probation, whoever's involved, that, hey, this person, I want you to know they are in the hospital. At that point, they may take them to motions court and have them released. It has nothing to do with imminent death.
Okay, but my question was about the fact that we as this board had a conversation with the administration, and it was said that we as this board would be notified when someone is released from custody because of the reasons you just outlined. And I know that one of those happened last week and we were not notified.
There was a 6A release last week, but there was also someone else that was in the hospital that was not part of a 6A release that was released, so I'm not really sure which one you're speaking of.
I am talking about the 6A releases that I said I
I'm
was
not sure
asking
who's
about.
supposed to notify the board of a 6A release. So
I can pull that up in the recent meeting minutes. We had a very clear conversation about that, and actually even Mr. Backrack chimed in on that. We were not asking for names. We were asking the board to be notified when someone receives a 6A release as a result of
I guess
hospital.
Then clarification, and we were discussing like certain emails that we can send information to that, if you have a county email, then if that's more secure than, I don't know, either a Yahoo account or something else. But so you want if we would petition the court to release, you want us to email saying that
We petitioned the court to release someone from the jail because of a medical emergency.
not a name, nothing
No,
like
kind of the
that.
same way you notify us about deaths. I would like to get that same, like, kind of very soon notification that this, maybe a death is imminent, maybe just someone was so unwell that you felt the need, but I don't need their name.
Okay, so I guess if, we can send that. I just would want to make sure that, I guess the emails that
County
we're
emails.
sending to are correct to send them to for us, so
Yeah,
that
so you're not sending
we
that
don't end up in
information
an
to
issue
someone
later on with it, that's all.
I think the county executive, did you mention in a previous meeting you were looking into getting like the community members, county ones?
We're having a conversation. Yeah.
We're going to have a conversation?
We were discussing that
Yeah.
for security purposes.
Is there any update? I don't know how
There's
difficult.
no update
There's no
on it,
update,
but
okay.
It is something that we are exploring.
Okay, I appreciate that.
Are we able to talk about that first prior to starting sending these emails, or?
No, I think for now, you can send them.
You could why don't you send them to me?
Okay.
And I will distribute them to the board members who have county emails, and the other
call 'em
board
up and tell 'em
members,
about
I will, well, I think I will just bring them a paper copy at the next meeting until we figure something out. I don't,
You guys are the ones without the county emails. Do you have any objections to that? Okay. But discrimination against the community members. Yeah, does anybody have any objections to that while we figure it out? I just don't want to wait any longer for it. Cool?
okay, that's fine. So, but let's clarify. You are going to provide notice whenever you, the jail,
Yes.
request of the court, we'd like you to release this individual for medical purposes, right?
Sure.
Correct, that's what I'm
Okay,
asking
it's
for.
the jail requesting it.
Yes.
So it's not the actual individuals who are released, but just when a request is made?
No names.
Oh,
Oh, no, we want to know that that it's granted.
Right. So it's only those where we petition the court.
and it's granted.
And it's granted.
Yes.
Wow, I mean, the first one is interesting as well. I would like that as well. If the jail thinks someone is so bad off that they would need it.
Do you want both? Is there a big difference in the numbers?
Yes.
There is.
You ask for them often and are denied by the courts?
No, well, it's a 50/50.
Well, then yes, I definitely would like to know both.
I mean, I have a long list of people that I request to be considered for release. Obviously, some are not released because their charges are so severe. But I can tell you, I started this process in December of 22, and 344 releases occurred because of it.
What, September of 22 till now?
December of 22.
December of 22, so what's that, like 15 months? Yeah, I would definitely like both of those
Okay,
numbers.
but that's not necessarily people that went to the hospital.
No, those are.
Okay, so-
Those did not go to hospital.
Because the request was people who go to the hospital.
Yeah, sorry, that is really what I want to know. I mean, that is a very interesting number to me as well, though I would like to know that. Can you tell me a little bit about why, other reasons that you would ask if it wasn't somebody's medical condition?
Well, no, they are all related.
It is their medical condition.
Then yeah, I want to know all of them.
What's the board,
What was the,
does the board want
as
to,
to what the relevance would be if it's not, if we're inquiring about release to hospital, what would the relevance be then otherwise?
To see.
We're not getting specific information about who the people are. So what exactly would the relevance?
To me, it would be how many people the jail identifies as in serious health concern, even if they're not being sent out to the hospital. I think a big thing that this board has been trying to focus on is improving the health care at the jail and making sure that people don't die. And I think that that's a really big one. Especially, I'd like to see, are people dying because they were denied release by the courts?
Well, then what I would want to see is if that's the case, then where's their location in the jail? In other words, if they were
can you
denied.
turn your mic on?
Yeah. Oh, yeah, that'd be cool with me.
I think it is on.
Oh.
If they're denied release, then are they sitting on a pod or are they in your medical ward? Because I've personally been asked to release
They could
people
still
who
be.
aren't even in the medical.
Yeah, I think that's a really good one. I would
I
like
can
that.
tell you that.
Most of those that are on my critical inmate list are either on 5B, which is our medical unit, or on 5E, which is our step down.
Right. So I've been asked to release people that aren't even on the medical
Right.
unit.
Yeah, so I think that'd be
I'm just
helpful
saying,
then.
So when you're told that people are being asked for medical reasons, they're not necessarily so critically ill that they're in a medical ward. They're
Right, or maybe
actually
they're
on a
very
regular
elderly.
pod. So you have to look at these in a. So if
Are
you're
you cool with
gonna
that?
if you're gonna get that information, get the information about where they are in the jail too, because they're not, again, ill enough to be in a hospital. So if you're going to ask for medical release, then where are they
Right.
in the actual jail?
I like that, Judge Bigley. I think that's a good idea.
Okay, so tell Judge Bigley, can you phrase what should be
So
released
if
to us?
you're going to disseminate the information about if medical releases were denied, where were the individuals being housed in the jail at the
Oh,
time?
just to
Were they
include
in-
that
were they on the
information.
medical
In the
unit or
information they're
not?
giving us, can they include the pod that the
Okay,
person
I
was
just
located
hate
on?
this to be a fishing expedition, okay?
I'm not fishing, I'm just trying to count numbers.
Well, but our function as the Jail Oversight Board is not the Court Oversight Board.
Oh, I'm
okay?
sorry, I'm not trying to get
And
oversight,
I'm not,
yeah, of
no,
the
no,
court.
no, no, no.
Well, I would
I'm
like
just-
that, but I
know-
won't, yeah.
I'm just saying,
Yeah.
we have to remember what our job is.
And I think it's helpful because we will never know who the judge was, right? So
No,
it's
I
not
don't
really a
care.
court
I'm not trying
expedition.
to
Or who
hide
the defendant
something.
was.
Or who the
I think
defendant
I think
was.
it's important, though, like you said, but just to figure out is what was the reasoning behind asking? Sometimes I always wonder, too, is it an issue of was the person really ill, or do we just not want to pay for this person's treatment? Like, what is it? Because that's the first thing I wonder, too. Is it, do you just not want to treat the person? Do you not want to pay for it? Like, what is it? So I'd want to see, too, where was the person in the jail? Was the person just sitting on the pod? Was the person ill enough to be in the medical ward, or was the person in the hospital? I think that's interesting, too. Find out where they were.
It's just data for us.
Okay,
Yeah.
so,
Data is data.
okay, so we are requesting the jail administration to provide notice of all administration requests of the court to release an inmate for medical reasons, and to include in your request what pod the person was on.
And if the request was
Going
fulfilled.
forward, not going
Yeah.
back.
Yeah, not going backwards, starting like now going forward, but also, and if it was
Every person
granted.
I make a request for, you want to know even if they're not hospitalized.
Correct.
How cumbersome is this?
She's already reporting it.
It could be a lot. I mean, I already reported out to the courts, depending on what.
Oh, but okay, but you already prepare it, so who
Right.
cares if you just forward it to me also,
Okay.
right? I mean, that's not going to take.
The one thing I think you did mention, Judge Ivashevik, is we
Yeah.
want to know, like, which ones were granted to. So if she's going to give us all the requests with the pods, make sure that they denote this one was granted and released. Cool?
Okay.
Awesome.
All
Thank
right,
you. I think
thank
that's
you.
helpful.
Just to clarify, and one of the reasons, like the medical history and the reasoning for the request will be set forth in the.
I put it all on the form.
Okay.
Okay.
Okay. Thank you. That was only one question. I do have some more. But I think that is going to be really, really helpful, especially with our healthcare advisory board that we're putting together. I think that will be really good information for them. Okay, so another thing that was brought up in the public comments was about the mortality reviews, and we got the report today about the NCCHC doing the comprehensive mortality reviews, but my understanding has been those were going backwards, like the historical mortality reviews, and the standard actually says that we need to conduct those within 30 days. So is the NCCHC contracted to come to the jail within 30 days of any death in custody, or is there another entity or staff person at the jail being hired to do that?
When someone dies, we do a mortality review within the jail within 30 days with our staff. And then we take that information, and when NCCHC comes in to do their mortality review, we provide them with all of the information that we have and any changes that we've made, and then they follow up to make sure that we have actually made those changes related to that death.
And they are two different types of mortality reviews, the one that you're doing internally and the one that NCCHC is doing?
It's basically along the same lines. We investigate what happened, timelines, all of that, and then we provide them with that data, and then they look at maybe other things that we didn't think about looking at.
Okay, so there is a mortality review happening within 30 days of every death in the jail.
Absolutely.
And when did that practice start? Because I know that wasn't the case at least a few months ago.
Oh, no, that's been for at least a year, over a year.
When I was at the last jail oversight board, I was confused between the administrative and the clinicals. So I was clarified after that. So I apologize for not following up with the board because I spoke to it at that last one.
Oh, no, that's okay. I don't blame you at all. I just want to make sure that we all understand what's
But
happening.
as DHSA Shaw mentioned, the clinical death reviews are being conducted as well as administrative reviews. And the clinical one started, I believe we said it was sometime last year. And again, the county manager's office is contracted to make sure that, as well as we ensure that NCCHC comes back and does a comprehensive, which includes review of the administrative and the clinicals. So they're looking at all the death reviews that are conducted on any mortalities within the facility.
But it's my understanding that the standard says the full scope of mortality review has to be done within 30 days because they specifically say that so that people, tend to forget things over time, evidence tends to disappear, people tend to leave.
Administrative, clinical, those are completed. Psychological, until the autopsy report's done, cannot be conducted because we don't know if it was a suicide because that's only done on suicide, so that one doesn't require the 30 days. So we are fulfilling it internally, as DHSA Shaw said. And then we have a comprehensive one, just somebody else coming in and looking at the mortality death review. So we do it twice. Every death now has 2 reviews completed, one internally and one by an external provider.
Okay, but only one happens within 30 days.
Correct. Unless one of those deaths happens within 30 days of when NCCHC comes in.
Are those internal reviews available to us?
Those are internal reviews records are always available for you to view when you come to the facility.
John Kay's shaking his head, so I don't really believe what I'm hearing right now. Can I just phone a friend real quick? Can I just phone a friend real quick to John Kay, because he's...
Can I just say something real quick? Okay, in terms of the mortality reviews, reading the standard, it's very important that it's a doctor that conducts that, and it's not the doctor that was providing that particular service.
Right, that's why I thought it had to be an outside one.
The question is, other than the doctors involved,
So
the
an-
doctor that conducted,
Okay.
was providing the service is not the same doctor that conducts the review.
So you're saying an independent doctor, not the treating doctor, has to conduct the review? Okay, is that what you do?
Okay, within 30 days?
Yes.
All right. Awesome. That is news to me, but thank you for that. Okay, next thing is, I want to, what kind of things do you call the hospital for? Like, I'm trying to get an understanding of, like, what medical services can be provided inside the jail, because I know when we were there, like, a week ago, somebody was getting, like, an arm reset. Like, there's some pretty intensive medical procedures you're capable of doing in the jail. How do you decide what things you call out for?
So we have orthopedics that comes in the jail, we have cardiology that comes in the jail, we have women's health that come in the jail. Those are limited by the equipment that they have in the jail. So say someone needed an ultrasound that we can't actually provide in the jail, for a woman that needs a mammogram, we generally get an ultrasound done with that at the same time to rule out anything, because it is difficult to get people in and out to appointments. So we would have both of those done outside the jail. And the cardiologist or the orthopedic doctor in the jail a lot of times makes that decision whether it's something that can be done in the jail or needs to be sent out for it.
Okay, so it is always a medical professional determining if the hospital needs to be called?
Yes.
Okay. Always?
Yes.
Okay. I also heard, again, another thing, I'm just trying to make my way through my public comments, is someone saying that they were denied access to their own medical records while they were in the jail. What, can somebody speak to that? Are you allowed to access your medical records while you are currently incarcerated? I know the process for once you're released.
If you want to see your medical records while you're in the jail, you do an ROI, a request for information, and then they would, the medical records would run that and bring the records to you.
Okay, so is there ever an instance where someone would be denied access to their own medical records in the jail?
I can't think of any.
Okay. My next question is about, the Suboxone, guys, I'm going to say this for like the 100th time. I'm so mad about how we're giving out Suboxone. Even just like seeing the reports of it literally looks like the Suboxone provider is copy and pasting the same evaluation every time she's doing them for people. The words are the same, even weeks apart and months apart. It is truly a copy and paste of the evaluation of people on Suboxone. So I would implore, if you are the supervisor for that, I would really implore you to please look at how that program is running. I'm so glad we have Suboxone offered in the jail, but I am so concerned about how it's running. I've told you I was on Suboxone for many years, and if I would have taken my entire daily dose at once, let alone in the middle of the night, I would have been super high in the middle of the night and then sick before the day's over. But also, I wouldn't have slept. It just doesn't make sense to me how we're doing it, and I know individual determinations are not being made, because I see even within individuals' medical records how it is literally being copy and pasted, saying this person has no complaints, everything's going great, exact same symptoms that the provider is seeing every single time she talks to them. There's no way that that's true, and there's no way that's a coincidence. So I really want to implore, I am going to be, in addition to this healthcare advisory committee, which I love you for that, that is such a great idea, it is so needed. I am going to, under our statute, we have investigatory powers. On the next month's, under new business, I'm going to be putting a motion for an official investigation into the Suboxone practice of how it's being handed out, all the doses at once, and then in the middle of the night. And it seems very clear that individual determinations are not being made. So I would just implore you that if you can fix that, please do it before next month, because I do not think anybody on this board would stop that investigation from happening.
Just a point of clarity on that. That's a service that's provided by someone you contract with?
Yes.
Correct?
Yes.
Would they be available to provide us?
Absolutely. I was just going to say, I implore you to come in and make rounds with her one day.
Yeah.
Or I can't come in the middle of the night. I have a full-time job.
She's not there in the middle of the night. She's there during the day, and I would like you to make rounds with her and actually see the people and listen to the evaluations that she does.
So I know for a fact that at least one patient has complained, and that in their medical report, it was put no complaints were made about the way that this medication is affecting them.
I still say to you, I wish that you would come in and make rounds with her one day.
Sure. Can you please invite her to the next Jail Oversight Board meeting, and I would like to talk to her here.
She is available.
Okay. Yeah. When is she on site? I know I tried to find that out from another staff member previously, but my understanding is she is not on staff at the jail 40 hours a week.
Yes, she is.
She is at what time?
I'm not sure what her hours are. I think she's 7 to 3 or 8 to 4. I'm not sure.
Okay. All right. Anybody else want to do that with me? Do you want to ask a question about that? You can.
I have a question. So what is the medical background of the person that prescribes administration of the medicine in the middle of the night? Is this
The Suboxone?
Yes.
That would be a nurse practitioner.
Okay, so it's not an MD that makes that
no.
determination?
We're hoping that eventually we can get one on board to to facilitate the growth of our program, to oversee 2 nurse practitioners. That's our ultimate goal, but right now, no, we don't have a doctor in the facility that just does that.
Can we speak to a physician about the practice of waking people up in the middle of the night and giving them this medicine?
Do you want to speak to the practitioner that does that? I mean, we also work with Dr. Venkat in the community, who Tori speaks to often about the prescribing.
I'm not an MD, but I think we should talk to an MD to make sure that I'm certain that that's not
That's who wrote
best
all of our
practices.
protocols.
Can I say, we talked about this, if you watch the jail oversight board meeting of, when did they explain the reason why it's done at this time? Was that January or
Staffing
February?
issues, and because they need to.
No, they specifically did not also say staffing issues. They also explained about the incarcerated population and then the need for people who are
observation.
going into court and all that. I'm not excusing it. I'm just saying we went through this whole explanation of why at this point, until they can change it, that it's being done at this time, and that they hope going forward to change it. I'm just saying, but at least at this time, we went over this, I think, both in January and in February. But if somebody, you could watch the explanation of at least why.
Yeah.
I did listen in the February meeting, but there was no physician that came in and said that it's okay to wake people up in the middle of the night to give them medicine that's going to interrupt their sleep.
Well, the person, all I'm saying, though, is that the person is qualified. She's qualified to write a script. I don't know, I'm sure you can find somebody who will disagree, but she's not unqualified, is all I'm saying. I'm not, we can agree or disagree, but that's what's being done now. We hope not to do it going forward, but I'm just saying, what's the point of bringing someone in who agrees or disagrees?
I guess respectfully, I want them to change it. So that,
I totally get that. I'm just saying, but saying, can we bring in a doctor that says it's okay to do it? I don't see the point of that. I guess we are all saying it's not the ideal situation. We all agreed with that. It's not ideal, but it's what they're doing out of, I guess, necessity, and then also because of both the fact that it's an incarcerated population, and then the fact that they have to, the observation, the fact that they have these, I guess, I don't know, it wasn't activities, but the schedule, and also that they may go to court, and for all these things, and for the scheduling and the way they're doing, they're working on it, they're coming up with a plan, but at least for now, that this is what they were doing. And I'm not trying to be difficult, I'm just saying, the fact that the person is a nurse practitioner doesn't make her necessarily unqualified.
Yeah, and point of clarification, Judge Bigley, I don't believe that I or Mr. Perkins or anybody was saying that we believe that anyone is unqualified medical professional-wise. What we're saying is, or at least, sorry, I don't want to speak for you. What I'm saying is that I know for a fact that this practice is not best practice, and in these exit interviews that we've been having, and these conversations that we've been having with medical staff in the jail, overwhelmingly the reason that they're leaving is because they feel that the jail administration, because of staffing issues or whatever other issues, are requiring them to do their medical professional job in a way that violates their licensing requirements, in a way that violates best practices of medical practice and medical care. And so if we want to keep these staff, which we need to so badly, we need to make sure that the jail is putting best practices first and is not tailoring medical decisions to staffing needs and convenience. And that's what it seems like is happening with this Suboxone.
Which is why we're setting up all these committees. It's just that we all understand that that is what they are doing now in the hopes that we're going to get to where we're going. But again, the fact that we keep going back to what they're doing now, we have been saying for the past 2 months that that's what we hope to not do in the future.
But if in the meantime records are being falsified, I think that that is a very serious issue that we should be being talked about.
Who says they're being falsified?
Well, I don't want to make any allegations without citing to specific evidence, but I have personally seen things that make me worry.
How are we seeing medical records? How is anyone?
Individuals have access to their medical records after they leave incarceration and while they're in the jail. And so when I see documentation that shows me copy and pasted reports about the assessments that are required when they are giving MOUD, when I see and talk to many medical providers that say in no world are individualized determinations being made about these folks receiving their MOUD if every person is being individually determined to receive these medications all at once and in the middle of the night, when I have all this information, I am very, very concerned that it's not just the jail's trying and they're not there yet, but that actually it's potential that illegal things are happening and things that are causing people to leave their job at the jail.
I don't know. I just think, well, I don't know. I just think that's irresponsible to say something that, I do.
It's something I'm concerned about, but I can move on to a different line of
I think being concerned
questioning.
is one thing, but saying something is, I just think that is irresponsible to say something that explosive when you don't have the actual proof that that's the case.
Well, you asked for clarification, so I wanted to tell you why I'm so concerned.
Clarification is one thing, but
Yes.
for an individual who you haven't met, talked to, or made rounds with, and to say that she would, to not make her rounds and not make an individual determination from individuals who supposedly provided you with copies of their own medical records, and then you've gone outside, and I, with all due respect, Councilwoman, that you've talked to other doctors who don't have any dealings with the jail, okay, who are now questioning an individual who they don't know who's employed by the jail and say that she couldn't possibly have done these assessments is ridiculous. But let's at least get the proof and then deal with it. But I'm otherwise going to assume that she's responsible and has done them, and then from now on, again, we're going to go forward hoping that we can change the practice. But to assume that she's not doing it, I'm just not going to take that.
I'm sorry, Judge Bigley, but you yourself just said and recited what the jail has told us previously, that the reasons that they're doing things the way they are not because of individualized determinations.
No, they very clearly on every occasion have said that that individual did those assessments individually, and that there were other considerations, and they were multiple in nature, but that every individual that was, every resident had an individual assessment, but that in addition to those, there were other considerations that went into the timing of the administration.
The timing of the administration.
The timing is what I'm very concerned about,
But
along
that
with
the
the
dosages came from individual assessments.
Okay, I'm stopping this discussion because we're going round and round in circles. I think every member of this board would like to see the medication administered at separate times and not all at once. I think every member of the board would like to see the medication not administered in the middle of the night, okay? But where are we going with keep talking about this?
No, I was just letting people know that I'm going to be motioning for an official
Okay.
investigation into this by this board at the
Okay.
next month's
All right,
meeting. But I can move on to the
okay,
next
let's
thing.
I'm sorry, excuse me.
Oh, you wanna go
I hate to interject before we move on. In the letter that Tanisha from the ALC provided to the full board, it mentions this very thing. I'm going to read 2 paragraphs. For 5 months, ACJ has continued to administer Mrs. Sabo 24 milligrams of his extended release Suboxone at 3 a.m. The improper administration of his Suboxone has caused him to feel withdrawal symptoms, experiencing cravings and pain. It adversely affects his other medical and mental health conditions as well. Another one. Importantly, Mr. Sabo has repeatedly told Tori Pipak, the physician assistant who prescribes his Suboxone medication, as well as the Suboxone nurses, that he objects to his Suboxone being administered in this manner and has explained in detail all the ways it has been harming him. That's it.
Thank you.
Thanks, Manny. Okay. Yeah, so we're going to be on that. So I just implore you guys to kind of get that together over the next month. But if I can get a day off work, I will try to get down to the jail between 7 a.m. and 3 p.m. to talk to her. So I'm going to move on to my next line of questioning. This is specifically about administrative custody and disciplinary housing. I don't know who I should be some direct my questioning to. Okay, so I know we've talked at previous meetings. Actually, you gave like really detailed information about the difference between DHU, RHU, and administrative custody. And so I'm not going to go through that again because you actually answered all my questions about that. I want to know if you can, specifically about DHU, RHU, walk me through the process. A lot of the complaints that we've received when we've been going to the jail for our inspections lately have been about misconduct. It seems like a lot of people are just receiving misconducts that they don't have much information about, being held in administrative custody with like no end date in sight. So I'm wondering if you can walk me through the process of how somebody gets onto DHU and answer a couple questions about it. So first would be, what happens after somebody receives a misconduct ticket?
So a couple things could happen. Depending on the severity of the misconduct, they could either go to 6F or to 8E. And both of those moves are after they're taken to the medical housing unit where they're cleared by physical and mental health before they're placed in restrictive custody, okay? Once they're placed there, then they have their hearing, their misconduct hearing held within 10 business days, minus weekends and holidays. And if they're found guilty, then a sentence is handed down by the hearing officer.
Okay, so are they informed of their rights for that hearing when they are given the misconduct ticket?
As far as what?
Well, that's kind of my next question. What are their rights in that hearing?
So they have a right to call witnesses, they have a right to give a inmate statement at those hearings?
They have a right to legal representation.
No. They're not being charged criminally.
Okay. Do their witnesses have to be other incarcerated individuals?
They don't have to be, no.
Can their witness be someone who also happens to be a lawyer?
A jail employee?
No, I'm just saying in general. Can it be somebody?
Nobody from the outside, if that's what you're asking.
No one from the outside can be called as a witness?
Correct.
Okay.
Right.
So are they informed of these rights to call witnesses and to give a statement and that to have a hearing intended?
I'll have to look at the misconduct form, but I believe there's verbiage on there, but I'll verify that.
On the form, okay.
Don't quote me on that.
And are those, no, but you'll come back with something I can quote you on next month, right?
Why
I
don't
would
you
appreciate it.
provide a copy of the misconduct?
Yeah, thank you. That's a really good idea.
Sure.
And are they all done on paper still, or are these things that have been translated to getting on the tablets now?
The misconducts are all on paper.
All on paper,
Yes.
okay. This is the carbon copy?
Correct.
Okay, gotcha. What if someone is unable to read or a non-native English speaker? How do you handle notifying them of the misconduct?
We could do that through the language line,
Okay,
or if they don't read, we could always read it to them.
okay. Do they find out in that misconduct ticket what all is on there? Like, I know that I've seen what they're accused of, the date and time. Is there any other pertinent information? I guess we'll find that out when we see it.
The body of the misconduct is the narrative of what occurred, prompting the misconduct to be issued.
Okay.
Yeah.
So now, do they have the option to, plead guilty to the misconduct or fight the misconduct?
Yes. They have the opportunity to plead not guilty or guilty.
Right.
And then the hearing officer then, based on video review, misconduct reports from anybody else that may have been involved with, then they make their determination.
Okay. And is there a difference between potential punishments, actions that can be taken against them, whether they plead guilty or not guilty to the alleged misconduct?
I mean, they're not really working on plea deals, no.
But if I am charged with a misconduct and I plead guilty, am I going to receive a lesser sentence than someone who is found?
That's really up to the officer that's doing the hearing.
There's no policy on that?
Right.
Okay. Are they informed of what the potential ramifications could be if they are found to have, done this misconduct when they are charged with it?
I don't know what you're asking me.
For example, if I'm charged with having contraband, whenever I receive my misconduct, am I informed you could get 30 days in the hole up to 60 days in the hole, something like that?
I mean, it's been a long time since I did a misconduct hearing, but, there's always the potential per incident to receive up to 40 days of.
And that's the same for every single incident?
Right.
Okay. And are they informed of that?
I believe they are, yeah.
Okay. Is that in the misconduct sheet that we're going to see?
I don't think that's on that sheet, no.
How are they informed of that?
I'll find out.
Okay, thank you very much. Are they able to review the evidence against them prior to the proceeding?
They have the report that's contained within the misconduct report. That's all the access they have.
So just what's in the body of that text on the misconduct report?
Correct.
So any video footage or anything else that you have, they don't get to see that prior to their hearing?
Right.
Okay. What type of evidence is used in these hearings, other than witness testimony and the incarcerated individual's testimony?
They take the individual involved, they take their plea, their information, their version of the events, and then compare that with the reports, video that they have available to them.
Okay, so reports from jail staff?
Right.
Reports from other incarcerated individuals?
If they're called as witnesses or they bring inmate statement forms, yes.
Okay, video footage?
Right.
Anything else, anything that has been confiscated? I'm just trying to find out what all the types of evidence are that could be used against them in the
If
hearing.
anything's confiscated, I mean, there's photographs available to it, but the actual evidence is given to the internal affairs detachment with the jail.
Okay, and you said that the individual being charged with the misconduct can bring witnesses that are other incarcerated individuals. Does the jail also have the right to request other incarcerated individuals as witnesses against the person being charged with the misconduct?
We don't really need to.
Okay, why is that?
We already have the video in the reports, so we have the video of what happened.
So you have the video, but the person being charged with the misconduct does not. That's why they have to bring witnesses and you do not?
If they feel that our version of it is incorrect, yes.
Okay. Can they challenge any of the evidence that is presented against them in this hearing?
They can appeal it, yes.
So, but that's after I don't know if it's even called a verdict, a decision?
After a guilty, you can call it a verdict, sure.
Okay.
After a guilty verdict is handed down, a sentence is levied on that individual, then they have a certain amount of time to issue an appeal. I think it's 5 or 10 days after that.
Okay, 5 to 10 days after they receive that guilty verdict, okay. And are they made aware in writing of that ability to appeal?
That was all contained in the inmate handbook that's available on the tablets.
Okay, so it's in the handbook. Is it in the actual misconduct slip that you give them?
I don't believe so. Well, I'll find out.
We will all
I'll
find
get
out
you a
together
copy,
when we get the form. Yes, I'm excited about that. And so how do they appeal?
That's usually a tablet request.
Okay.
So that goes to the warden's group that's in there, and that's fielded usually by one of the majors, who then reviews the incident, the misconduct hearing, what happened, and then another decision is made.
Okay, so the appeals process would be, we have 5 to 10 days, which we're going to find out for sure, 5 to 10 days to submit an appeal, and then a major will review based off receiving that request. A major will review it, basically look at the evidence.
Right.
And say,
They'll either overturn it or uphold it.
so there's not an actual appeal hearing. It's just a major's decision.
Right.
Okay. And so there's no opportunity to provide additional evidence or witnesses at that appeals process because there is no hearing.
If the person would put that there's additional information available in that request, then sure, we would go see that person.
Okay. Sorry, are we going to add something else?
No.
Okay. Do I kind of have the whole totality of the DHU misconduct status? Is there anything else that we missed?
Every 30 days, a program review committee is done.
Program review committee?
Program review committee.
Okay.
PRC hearings. Okay, and that's done usually by a major also. So they have the ability to either uphold the original sentence or we can cut time off to let them out early if they've been, if their behavior's been appropriate in the RHUs.
But if they can only get like a max of 40 days, how helpful, how often do people actually get it overturned every 30 days?
It happens. I don't have a percentage of it, but.
Okay, and what is that based off of? Is it based off of behavior? Is it based off of other metrics?
Yeah, it's based off behavior from the officers that work those units, their reports of what's going on with the individual. Obviously, if they've caught additional misconducts, we're not going to cut any time off because now they have more time to walk off. Right?
So you could get a 40 on top of a 40 on top of a 40 on top of a 40?
Correct.
Okay, and is there any limit on that? Or
No.
you could be in DHU, RHU indefinitely if you kept receiving
That's
misconduct?
based on the individual's behavior.
Okay. And then for the AC status, is this the same process?
Right.
That's followed? So they still, because my understanding is for administrative custody, they can be on that indefinitely.
Correct. Same review, though. It's still done by the PRC review every 30 days. So those individuals are reviewed. And if it's appropriate, then they're removed from that status.
Okay, is there ever a time where someone can be reviewed, in less time than the 30-day review period?
Sure.
And what would elicit that additional review?
If it would be a juvenile,
What's the process for them? Is it,
it's 14 days, I believe. Yeah.
so every 14 days you review every juvenile on DHU, RHU, or administrative custody?
Right.
Okay. And what criteria is it that they're reviewed upon? Just behavior?
Based on why they were placed on that status, if anything had changed, if there's any updates.
And with the 14-day or 30-day review, is it communicated to them why they were either denied early release or approved to be let out early?
Yes, it's a face-to-face interview.
Okay.
Yeah.
And they will say, hey, you keep getting in trouble, or hey, you're doing great.
Right.
Okay. Is that in writing or is that just verbal?
There's a form. Yes.
Okay. And they get a copy of that?
They do not, no.
Okay. And for administrative custody, there's also an appeals process for that?
I mean, the appeals process would be the program review committee, so every 30 days, you'll have FaceTime with somebody.
So it is different than the DHU, RHU process that we just walked through?
Right.
Okay. I'm sorry, I thought you had said earlier that it was the same process. So what happens when someone is placed on administrative custody?
I don't know what you mean.
They get a misconduct ticket? Is the notification that they've been placed
No.
on that the same?
No. Administrative custody isn't based on behavioral issues not all the time. If we have somebody that's a significant behavioral issue continually, then we'll place them on administrative custody, okay? This could be, I mean, there's a lot of reasons to do it. It could be somebody that didn't want to check into protective custody. Maybe they have a high-profile case on the outside, so we place them on AC status for their own protection, okay? So then the review process happens every 30 days.
If it's for their own protection, does that mean that they can opt out of AC custody?
No.
Okay. So what is the due process that's given to the individuals who are in AC status?
The program review committee.
Okay, so once they are placed on it, there is no hearing, there is no evidence used against them, there are no witnesses called to testify to say they should be in administrative custody?
Right.
And then once they are placed on that, there is also no appeals process that they can request. The only review, once they are in there, the only information whatsoever happens every 30 days by the PRC?
Sure.
Okay. Yeah, that's kind of all I have. I just have one last thing that I want to say is I know we've been talking a lot about exit interviews, so for anyone's here, current staff, former jail staff, anybody watching at home, if you would currently work at the jail or you have left the jail within the past 2 years and you want an exit interview, hit me up. My DMs are open on social media. The county council office phone number is 412-350-6490. You can call my office. Please do not email me. The whole county has access to those emails. You never know. I will keep your name anonymous unless you ask me not to. I would really like to talk to as many people as possible. We have a very functioning board now who really wants to get stuff done. Please, please, please reach out to me if you want to talk to us. We can do it on your terms, whatever you want. I just want to get your information and we want to help. So looking at you guys at home, looking at Yins in here, please let me know if you want to talk to us. That's all I got. Thank you.
Thank you. Anybody else?
Yeah, I have a few questions. Very similar to the questions Ms. Holland was asking. So I met a man on the 27th named Jamal Crosby. He gave me permission to use his name. He was held in, I guess you call it DHU status. We call it the whole. Long story short, he tried to appeal, and he told me he got to run around for a couple months, and even the policies that are listed in his inmate handbook that he found on his tablet were not followed. So, I mean, first off, I want to know why that happened, but secondly, I want to know if we can get statistics on how many hearings are done per month, and what are the outcomes, and what are the sentences, and how many are appealed.
We can definitely look into Mr. Crosby's case for specifics. What time frame are we looking at? Was it recently? Is he still incarcerated?
He's still incarcerated. It was the end of last year. I think he said it was in November. And
23?
Yes. Yeah.
Okay, and as far as statistics, we don't really generate any spreadsheets or anything like that for numbers of hearings or outcomes, appeals, things like that. Because those all go through the OMS operating system, so for us to, there's no report made that we could pull that information out.
You have access to it, though?
To see it?
Yeah.
Yes.
If we were to come and visit the jail, will we be able to see it?
Yes.
All right, I got you. Second question is, I met another man who gave me permission to use his name. His name is Brian. He got released from the jail on Friday. around like 5:30, and what he told me is very similar to what we've heard a lot, was that the cashier was no longer there after he got released. So the money that he had on his books, he had $81 he didn't have access to. He had no way to get home. He wasn't even given a bus ticket like the discharge center is supposed to. I ordered him a Lyft from my phone, which is how he got home. And he also didn't have some of his other belongings, wallet, sunglasses. He didn't even have his ID, didn't have a bank card. So my question is, bottom line, why are people released without access to their belongings? Why is the cashier not available during the duration of releases throughout the day?
I can speak for the cashier. We recently had a resignation, so we don't have that second shift filled at this time. We're working to fill that, and then we'll be reestablished to have them to the 8 o'clock release time. What is the last name of the individual? You only provided a first?
Hat La Pataka. I'll provide. I'll spell it. HATLAPATKA. He said it was Russian. But. Not to be a jag, but I've been tabling outside of the jail for a while now, and every time somebody gets released during that window that we're out there from 5 to 8, they say the cashier isn't there. So this man got released on Friday. He wasn't able to go back for his belongings until Monday, so leaving him, essentially stranded for a couple of days.
Yeah, and that was brought to our attention. That's absolutely something for 7 days a week that we're willing to explore and look into. But like I mentioned, the one individual did resign, so we have that second shift that we're working to staff to the 8 o'clock release time. So we heard you on that one.
All right, thank you.
Hurry up, Mr. Perkins.
I have a couple medical-related questions. Is it okay if I email you a list of questions? Okay. So, and I'm new to the board, so a lot of them are probably basic, and you've probably communicated in the past. But the one question I have is that you indicated that there's not going to be the new medical director is going to start in May.
In May.
Is there currently a medical director?
We have an interim medical director right now, and he is only there usually a couple days a week, but he is available by phone if we need him. We do have other physicians that are on site that work there throughout, and PAs and nurse practitioners. So there's always a practitioner there. It's just not the medical director.
Is there, like, 24/7, is there a medical doctor on staff?
Well, a practitioner of some sort, nurse practitioner, PA, MD, DO, something. Somebody's there.
Okay, thank you.
Yep.
Mine's quick, I promise. I promise.
My turn. Go ahead. I do appreciate you, Councilwoman Hallam, for asking all the questions about 6A, because those were on my list of questions, so we got that out of the way. I'll be brief. Warden, you touched on, accommodating individual dietary restrictions. We know that Ramadan is coming up here on March 10th, and just wanted to hear from the team on how we plan on accommodating those who practice, what offerings we expect to have, and how we'll adjust times during which the food will be delivered so that it can meet the needs of those individuals.
I'm on it. Hi, I'm Reverend Dr. Howe. I direct chaplaincy at the jail. We sent out at the beginning of February to everyone who we had listed as Muslim in the facility. We sent them an application to ask them if they planned on participating in the Ramadan fast. Just like not everybody goes to church on Sunday morning, not everybody practices the fast during the fasting time. Those who selected that they did want to participate in the fast, we sent a list over to medical just to clear if it was medically advisable for those individuals to spend that amount of time in fasting each day for that long of a time. They let us know who was medically advised to fast or not to fast. For those who were advised not to, then we do have a waiver they can sign if they still plan on participating in the fast, just so that they know that the doctor has said it's probably not a great idea for you to fast for this time. Then we have a list that goes into the system. They're added to our religious diets list that comes out every day so that the kitchen team has that information. So they'll be getting that updated list every single day. People get transferred from one pod to another and released, so that way they'll have a daily updated list. Anyone new who comes into the facility within that time frame who identifies that they want to participate in the fast will then get that same process at that time so that we can get them added to the list. Starting on Sunday evening, each person will be given a sahur or a breakfast bag in the evening that they can keep in their cell until the morning. And then that way they'll be able to eat before the sun comes up. Since that's a little bit early to get breakfast trays out, we make sure to accommodate in that way. And then in the evening after the sun goes down, they'll get a double dinner tray that day.
Great, thank you for that.
Can I go? I promise it's so quick. Okay. The other night when Manny and I were at the jail doing a visit, inspection, we saw there was a person who was in intake. It was probably, 10:30, 11 o'clock at night. And there was a person in intake who was just begging for water. He couldn't drink the juice box that he got because he had a liver transplant and he just really needed water. I will say also, while we were talking to him and trying to get him water, a man had a seizure in front of our eyes, and it was terrifying. And I felt like the jail staff, of which there were many corrections officers standing around at the time that it happened, really just kind of took their time. And I know I personally was appalled because I was like, I'm pretty loud and can be obnoxious about things that I care about a lot. And they knew that we were right there watching this happen, and they just kind of took their time. And this man, I was terrified personally watching it happen behind a steel door that we couldn't do anything. So I did want to point that out and just hope maybe you can talk to the folks in intake when people are having medical emergencies, because if we wouldn't have been there trying to talk to this guy about getting him water, who knows when they would have found this man mid-seizure, right? But sorry, I digress. My question is about, I saw in the warden's report this thing about the NCCHC staff were complimentary of the jail's efforts at improvements that have been made, including the increased hydration offered at intake. And when I was asking for this man to get him a cup of water, the jail said he came in too late, he can't have any until the morning. And so I was just wondering, if you're being commended for the hydration offered at intake, what is that process? Because this was 10:30, quarter to 11. He had gotten there, I guess, after the last time they had given out water and was told he couldn't have any until the next morning. And they said that even to us. So I know he was told that. I was begging them, can you please just make an exception?
I can't even imagine why that would have happened. Usually they always have water in the back of intake for the nurses to give out. So that doesn't really make sense to me.
To anybody on request at any time?
It's not necessarily on request. It's for detox people, pregnant women. Those are the ones that we generally give water and Gatorade to. Otherwise, there's water in the cells.
But
You mean in the sink?
Yeah.
But this was a liver transplant recipient, and they said that they couldn't give him any water, not because he wasn't eligible to get water, but because of the time of the day.
I can't imagine, because he would have been banded at that point if he had had medical issues, and they would have...
Luckily, I now have a witness that is there as well, so he can tell you he heard this.
Can you look into this? What was the
what
date?
happened
What was
with
the date
this, and
and the
make sure that
time?
there's fluids down there, because, we were commended on our efforts in hydration.
Yeah,
Okay,
but
I'm in the middle of
he
it.
literally
What was
begged
the
us
date
for
and the
water. It
time?
was the 27th. It was between 10 or 11. I think it was 10:30 or so.
2:27.
10:30,
between
11.
10. Can you just look into who was on that shift, and
Lots
do they
of
know
people.
anything about this?
Yeah, there were many. There was one medical staff and tons of people in this BSIMS uniform. I don't want to say they were all COs. They might have been, other positions as well. But there were so many people there, and they wouldn't give this guy water.
And just an additional point to the staff taking their time to respond to this medical emergency. That's literally how Frank Smart died. All right, we call him Bucket. That's his nickname. He had a seizure in intake. He's the whole reason that we have a bail fund in Pittsburgh. To prevent stuff like this from happening. So for me to witness it, it was kind of jarring. But just be a little bit cognizant, I guess. But on the point of the water, I know you're saying it's unbelievable. I'm saying I thought it was unbelievable too that he wouldn't give him the water. He was literally begging for it.
Can I, one more thing? I think it's really horrible if people are released from jail and they can't get their personal possessions. Can you put somebody over there temporarily until you get somebody to fill this shift?
Personal property is different. I was only speaking to money on their trust account, so I couldn't speak to the property question that was asked.
But even their money.
Well, yeah, just to reiterate, he was denied some of his personal property, but like she said, even the money. Like, he literally wouldn't have been able to get home if I wasn't there, and I know this happens
Okay,
often.
is there two different places you go for your personal possessions and your money? So you're saying everybody can always get their personal possessions, but there's been a problem to get the money because somebody quit on this second shift?
Yeah, and we're working to fill it, and I understand the request, and we're doing our best to address it.
Just quick, are those individuals county employees or are they contracted
They're
out?
county employees.
Okay.
Yeah. What about maybe, I mean, this is just an idea. Can we like reach out to the treasurer's office? I know they do a lot with money. Maybe we can see if they have any ideas. We can brainstorm some things to do because Manny's right. Like that's all the money they have. It includes the money they came in with and any money on their books. How do they get home? You know, how do they, you know, buy a phone charger to charge their phone, buy clothes because it's cold out now and they came in summer. Like they really need to get that money when they leave. And so many people I know from, I think if Brad is still here, I remember him saying things about how like a lot of people just don't ever get their money because they don't want to come back to the jail on Monday. It's like, I was just in there. I never want to go back there again. So they just leave their stuff.
Okay, do I have a motion to adjourn?
So moved.
We don't have any.
Did somebody second? I'll second.
I forgot about it.
Aye.